Good morning. I'd like to welcome everyone to our August 20th, 2019 monthly work session. We're going to start this session with some very important work being done in our self-insured and wellness community. So I'd like to invite our CFO, Mitzi Corcoran, Lynn Peterson, and Aaron Singerman to the front table, please. Mitzi is
Cast of thousands.
and a cast of thousands. Welcome.
Good morning.
Good morning.
Okay. Well,
Mrs. Brown, our wonderful colleague, I don't know, I'm going to wave in case she's watching, is hospital bound with some knee surgery and may be joining us. Will certainly be watching, but maybe joining us from time to time, depending on her PT. So we're wishing her all of us are wishing her well. So to start this is Lynn Peterson.
good morning, and thank you for having us this morning so that we can give you a lot of good news. So we're going to change it up just a little bit. We originally had that we would do the self-insured medical and benefits update, but we're going to go ahead and let Erin do her wellness update because I feel like we will go a little bit longer on the medical side, and we don't want Erin to lose any time from being able to tell you about all the good things that are happening for our employees here at Sarasota County Schools. So, Erin?
All right, thanks. Good morning. All right, so I'm excited to share with you all some new and exciting program that we have in employee wellness for this school year. Before I get to that, I do have some updates on employee participation and engagement and some of our core activities. So let's go ahead and get started. Wellness at work. When I was doing some prep work for this workshop this morning, I came across an interesting statistic that I would like to share, which is that out of employers that have over 1,000 employees, 85% of them offer some sort of worksite wellness programming. I figured it would be high, but I was pleased to see that it was that high. And it went on to talk about things that we already knew, but are happy to share, which is not only do worksites realize that employee wellness programs have a direct correlation to healthcare costs, but they're also an opportunity to attract and retain talent. It's another benefit that we can offer to our employees. It has the opportunity to increase employee morale and to just impact the general culture of an organization. So we're pleased that we can be able to offer all of that through the wellness program. Research also shows that employee health is directly correlated to productivity and performance. And we know that employees here at the school district have one of the most important jobs out there. And so I feel it's my role as employee wellness coordinator, as well as the program, to be able to keep our teachers and our classified staff healthy and in the classroom and doing the best jobs that they can do. So the next slide, do we have slides up there? Okay. All right, perfect. I'm going to share with you some information we get from Florida Blue when we meet with them annually. They give us our top diagnostic conditions by spend, and we use this to determine what type of programming we're going to look at. When we meet with them every year, we find that it is generally the same categories in the top three. They just jockey back and forth for position on which one's going to be number one. It's cancer, musculoskeletal, and circulatory disorders. In the cancer category, we see a lot of breast cancer, skin cancer, some other ones such as lung cancer and lymphoma. And then in the musculoskeletal category is arthritis, back disorders, joint issues. That's where a lot of the hip and knee replacements fall. And then lastly, the circulatory system is where we see a lot of the cardiac issues and heart disease and hypertension. So this is good information for us to have so we can focus our programming that we do every year. Okay. This next slide is just a quick snapshot of where our employees are in their preventative health screenings. The goal of preventative health screenings are to stay healthy and hopefully catch things before they become catastrophic and possibly even life-threatening. So across the left-hand side, you can see the screenings that are offered through our plan. We have the adult wellness categories, male and female wellness, the breast cancer screenings, cervical cancer screening, and colorectal screening. The green bar is 2018, the blue bar below it is 2017. And as you can see, compared to last year, we are the same or more of our employees are getting their preventative health screenings. And as you can see, we greatly exceed the Florida Blue benchmark here. Another activity that we focus on throughout the year is our on-site biometric health screenings. These often reach people who might not otherwise see a doctor on an annual basis and get their blood work done. These screenings identify individuals who are at risk for cholesterol, diabetes, and blood pressure. As you can see, last school year compared to the year before, we saw a 43% increase in participation in the biometric screenings. We did visit a new site last year. We got to participate in Custodial Day and work with the custodians last year. And then just in general, employees are taking more advantage. More employees are taking advantage of what we have to offer. We saw 6 critical value employees last year. Those are individuals who are identified as needing to speak with a health care provider as soon as possible. They speak with the Florida Blue nurses who are on site. They're invited to engage in disease management programs. And thankfully, 77% of our population identified does engage in those programs. Again, compared to only 36% of the Florida Blue benchmark. And then just a quick update on our wellness incentive prevention pays. I know you guys are pretty familiar with this. It's the program that allows our employees to earn up to $100 for completing their preventative health screenings. This is a great program because the annual wellness exam is a requirement to be able to participate. So it encourages staff to have their annual wellness exam with the provider to establish that baseline and follow them over time. We did see another increase compared to last year. We finally broke the 1,000 number for participation, and that should hopefully go up just a little bit more since people are still submitting their forms. But we still hover right around the 20% participation for that. Now, on the positive side, we know people are getting their preventative health screenings. They're just not submitting the paperwork for some reason. So, right. Okay, on this slide, you'll see all the accomplishments that we have in employee wellness. This is quite a bit to go through, and we could probably spend the morning together going through it. So what I did was provided you with an appendix if you wanted to see everything that we were offering. On that appendix, you'll see the year it was implemented, because some programs have been long-standing. You can see the ones that have been added more recently. We've provided those years, as well as growth, if we were able to capture that. I just want to point out, in October, we'll be doing flu shots at all the schools, as well as we have our employee health fair October 14th. That continues to grow and expand. Last year we had 400 people out there. Yeah. So now I'm just going to highlight a couple of our programs that I'm really excited to share with you and passionate about. The first one is our Spotlight on Mobile Mammography. About 1 in 8 U.S. women will develop invasive breast cancer in her lifetime. We have 76% of our employees participating in mammography, compared to only 65% of the Florida Blue benchmark. That 76% seems high, but in my opinion, that's still 1 out of 4 who are not getting screened. And so our goal is to reach that 1 out of 4 so everyone can participate. So last year, what we did was we provided a pilot program to see how this all worked out. And we're partnering with Tampa Bay Mobile Mammography. They work with other districts as well. And last year, the bus visited 5 district sites, included the 2 health fairs, transportation, and the landings, as well as 13 elementary, middle, and high schools. And we broke it out so we could reach North County, Mid, and all the way down south. So at those locations, we screened 276 women at our first shot at this. Our first location we did the screening at was the Employee Health Fair last October, and we originally had 1 bus scheduled there, and they had to add a second bus. We screened 79 ladies at the health fair last year, and those spots filled up pretty quickly. So I think that was a pretty clear indication to us that there was a need there and it was going to be utilized. So we moved forward with the other locations. So when you take out the district sites and you just look at the schools, we screened about 10 ladies per school site. So what makes this work so well? They pretty much removed every single barrier that you can think of. They come to the school. They're offering 3D mammograms. It does run through our insurance as the preventative screening, so it's no cost to the participant. We encourage the teachers, at least the classroom employees, to schedule during their planning and during their lunch. But we know that that's not always going to work out that way. So Tampa Bay Mammography has committed to reimbursing us basically for a half-day floater sub for that school to take advantage of if they're interested. So we made that available last year, and a few of the schools took advantage of that, and it worked really well. So they charge the sub to Wellness. I keep track of it, and then we send off an invoice to Tampa Bay Mammography, and they reimburse us for that. And it literally takes 10 minutes to get it done. It's so fast. So what I wanted to do is actually share with you a few of the emails that I received. And I'm going to read them because I think they're really impactful. And what's great about these is these were unsolicited. People just emailed me these. The first one says, wow, having that mobile mammogram was such a wonderful experience. So convenient, so easy, so pain-free. Thank you, thank you, thank you. The second one was, I just had my mammogram done and they were great. It was my first one and they made it quick and painless. I spoke with another teacher and she said it was the best mammogram she's ever had. Thank you so much for helping us to set this up. And then the third one, I thought it was great. They were friendly and efficient. It was great to be able to just walk in, have it done with no waiting, and get back to work. The results were sent promptly to my doctor, which that one sounds coached because it's so perfect, Yeah. Which I forgot to mention on the previous slide. When someone signs up for the mammogram, they provide their doctor's information so the results can be sent to their doctor to ensure that continuum of care for them. Okay. And then the second program I just wanted to highlight this morning was our enhanced focus on emotional well-being for our employees this year. When you look at the definition of health, it is not just the absence of disease, but is the complete state of physical, emotional, and social well-being. And, this is an important part of the whole self-health. And so I'm excited to be able to offer more of this to staff this year. Emotional health helps determine how we handle stress and relate to others and make healthy choices. And on the flip side, low emotional well-being at work can result in overall sickness, poor health, and burnout. I want to tell you a little bit about our Employee Assistance Program, our EAP program, and Work-Life Services. We currently have Humana to provide this service. We have had them since January 2017, and they have been phenomenal. EAP is free for employees to participate in and members of their household, and that's an important indication to make. So if you have family members staying with you, whether or not they are on our insurance plan, they can participate in the EAP services. And Humana breaks down their EAP services into 2 categories, you could say. They have the EAP, which is the short-term counseling services that are a lot of us are aware of. They can offer 3 sessions per issue for free. And they cover things such as emotional issues, family, workplace concerns, and so on. But they do offer a second service that they call work-life services. And this is assistance, information, and support to help staff have a better balance between work and life. And they can provide support on things such as childcare, financing college, and caregiving. We had someone from EAP at Humana at one of our schools presenting on this during back to school week. And she shared an example of how she utilized the work-life services. And basically, she was going on a road trip with her dog, and she needed to know which hotels were pet-friendly and where there were dog parks along the way so she could walk her dog. So she reached out to them, and they sent her a list of all the pet-friendly hotels on her route and where she could stop to walk her dog. So she had to book the hotels herself, but they gave her the information. So that's how it can help with everyday issues. I do want to quickly mention our Florida Blue services because we do have mental health services through our health insurance as well. Those are phenomenal. They're a little bit more of a long-term plan, but the distinction of that is you need to be a member of the insurance to utilize that. So Humana, you do not have to be on the insurance plan. So our focus for this school year, we're calling Take 10. We're encouraging our employees to take at least 10 minutes for themselves every week to enhance their emotional and physical well-being. We've broken it down into monthly topics. We have work-life balance, mental health, motivation, happiness, and so on. And on the next slide, I'll be showing you a little bit more of what that's going to look like every month. So based on the topics that I just mentioned, we'll be working with Humana. Pretty much most of the content is from them since they're the experts in this area. I will be packaging up content as it relates to those topics and sending it out to the wellness champions that are housed at each site, because we have a wellness champion at each one of our school sites and at some of our large departments. And included in that is going to be articles, webinars, videos, online quizzes, some monthly challenges to help support that topic. We'll also be offering in-person seminars on those topics at a variety of locations. We're gonna give something a try and see if we can expand it. We're working with Humana to bring out some of their providers to bring on site, where if people need to get that initial contact set up to speak with a mental health provider, that they can do that and establish that. So again, trying to remove another barrier for them. We're going to continue to offer free yoga. It's a great stress management tool at multiple sites, as well as other fitness classes. And then again, looking at the whole self, the Florida Blue biometric screenings, the flu shots, the mammography, all kinds of wellness activities throughout the year that'll tie into these themes. This is an example. Well, it's the fall calendar, actually. I felt it was the best way to show what this would look like would just be to share with you the calendar. So you can see the monthly theme across the top. Across the left-hand side are the different types of educational materials we'll be providing, from the seminars to the electronic information, and then some of the other wellness activities and what that's going to look like. Okay. And then I just wanted to end on the contact information for Humana and our EAP services. It is a goal of us this year to make sure that every employee is aware that this is out there and available to them to utilize. And that's it.
Thank you, Erin.
You're welcome.
Great things going on. Now, we have a fitness center here that a lot of people are taking advantage of, but we don't have fitness centers anywhere else, correct?
We do. At the moment, the only one we have is here at the landings. Mm-hmm. This location was identified due to the number of people that are here and the number of desk jobs that we have to get people to get up and move around. But we are discussing other locations.
We continue to look for other locations. Space is always the issue.
But some schools have them, and they open them up for employees, because I've visited with those schools that do that. I just can't exactly remember where they are, but I think that's
every
really
school has that
Right.
ability. At the high schools, the middle schools, they all have the gyms, and employees just have to sign a waiver and follow whatever the school hours are for the employee to be able to utilize. Certainly, the school may have rules against utilizing it when some of the teams are in there and that sort of
Right.
thing. But as long as they sign the employee waiver form, then they can utilize those facilities.
Great.
Yeah.
Well, thank you. Great job you're doing.
Thanks. All right.
A lot of good things.
All right. Thank you.
I did my peanut M&Ms. I didn't want to eat them while she was sick.
Now she goes.
Yeah, that wouldn't
Now
look
you
very,
can eat your M&Ms.
that wouldn't look very good, would it? Thank you.
Good job, Mary.
So now I'd like to bring up Paul Booten from Aon, as well as Mitzi Corcoran, and we're going to talk about the medical plan, the self-insured medical plan, and benefits. As you can see, just from what you heard with the wellness and our high-cost drivers, you could see that I wanted to show you our high-cost drivers are our high-cost claimants. We have 65 high-cost claimants that cost us 25% of our medical spend. So over $12 million is paid out for just 65 people, which is just about 1% of the members on our plan. It's very important to treat employees, get employees to realize and get the preventative screenings to identify what potential illnesses they may have so that they can be treated early. Early treatment is going to help with being less for the medical plan.
Eric?
I remember when we did the first self-insurance plan, we talked about the high people, but then we also talked about having a backstop if they were over a certain number
That's correct. For the stop loss.
for the stop loss.
Yes, we do have that. The stop loss, the high-cost claimants are at $100,000. That's how they're identified. Any claim $100,000 or more is a high-cost claimant. We do have stop loss. We've increased that to $650,000. So we do have that stop loss for a claim that reaches that. We're very fortunate that we have
Wasn't it 400 at some point?
Initially, it was 500,000, and we didn't have any. So it's very expensive to have stop loss insurance. Right. So as we are also self-insured for most of our workers' comp, and we have a $750,000 stop loss on the workers' comp. So we are familiar with that risk. So we increased because of cost savings, and we weren't seeing those claims hit our stop loss at 500. We said, let's go ahead and up that, because we were seeing stop loss increases by about 20% every year. And it is not by your experience, it's by the company's book of business. So it doesn't matter that you're doing well, you're still going to see an increase in that cost.
65, 12 million.
So 65 people are costing the district $12 million. That is
Their
correct.
average is 200. Okay, or
Yeah.
a little, whatever, average.
So with that, the high cost drivers for those 65 people are cancer, most are cancer, 40%, circulatory, and rare conditions. So we identify that we want to make sure that we are letting our employees have the ability to get screenings, and we're promoting that so that they can be aware of if it is there and it's a potential, it doesn't go to the later stages.
It's like anything that we do, or it's like anything with your house. If there's a small problem with an air conditioning unit and you fix it, then you don't have a problem. But if you allow it to go, and it's the same thing happens with people's health. What are we spending? We're spending $48 million?
Yeah, we're actually a little more. There's a lag in some claims, the way the data falls here on this high-cost driver page, but we're projected to spend more than that because of the way the claims came in. Actuals I'm looking at here versus projected, and so yeah, it's we're going to be looking at $50+ $2+ million.
I don't know if any of our partners have heard this, but I have heard this within the last couple of months, that the legislature is looking at how much money we're spending on our benefit package for our employees. And they are going to give us a sharp rap on the knuckles, shall we say. And we're spending more, I think, than some other larger districts that I have compared us to are spending.
We are, definitely.
But I'm concerned about that because, I mean, you know, it's one other thing that they seem to be going after, but their philosophy is that if we weren't spending so much, then we could spend this money or these dollars on other operating issues. So I just wondered if you had heard or seen or...
I have not seen that from the Florida legislature. We have seen some other initiatives come out, but I've not seen that one.
Well, I think we should be looking at this or looking at it more closely because I'm concerned, and I had a meeting within the last few weeks with someone who seemed to think this was something that we needed to be concerned about as a team or as a district.
We do spend a lot, and I know Mitzi has numbers for you, but we spend a lot because we have our employees have zero cost, and we have 4 choices of plans, very high and very rich plans.
That's right.
For our employees, and they cost a lot of money.
Yes.
We're, in comparison to other districts, we are above and beyond what the other districts offer.
Correct.
Right. So for example, our spend for the employer for last fiscal year was almost $43 million for the health insurance. So with about 5,300 active employees, that's about $8,100 a year per employee just for medical. When you add these other coverages that most other school districts do not even offer, which is dental, vision, life, disability, most of those are voluntary plans on the part of school districts. That kind of takes it a little bit closer to $8,600 a year for the employers. And then, of course, when you add all of your statutory FRSs and your Social Securities and everything else, you're pushing $17,000+ an employee on average. So yes, it's quite high.
Okay.
So going back, I'll finish up this slide. Just 28% of our high-cost claimants have a diagnosis of diabetes. So again, just highlighting that is a focus of us in wellness, to address that and to have employees be able to realize that they could be walking around pre-diabetic without knowing if they don't get tested. So the screenings are helpful for that. And our top 3 for all members are cancer, musculoskeletal, and circulatory, such as heart disease and that sort of thing. So these are the drivers, and this is what we focus on. Next slide. So we brought to you some strategies last year for cost savings, and one of them was Teladoc. We implemented. The board approved that in April of 18. It was implemented in August of 18 last year, so 1 full year of having Teladoc. Teladoc is telemedicine, so employees can call if they're feeling ill and see a doctor on their phone or on their computer and not even leave their desk or their home to be able to have that appointment. The cost for that is significantly less than seeing their primary care doctor. So there's a savings there. And we also encouraged by lowering our copays for those visits by $5. And the members on the low PPO benefit the most. Just as a reminder, we talked about that last year. They have a $1,500 deductible, and they have a co-insurance. They have a percentage that they have to pay after the deductible. So they wouldn't even be able to utilize that if we didn't do a flat $25 copay for them on the Teladoc. So that encourages them to utilize it and save that money. We've had over 1,700 members register, and then we have like a net savings of over $300,000 just from the utilization. The next page
is that a high utilization?
So the next page shows you the utilization, and I think it's pretty good. Obviously, we have nothing to compare it to
Right.
with our own records, and
Right.
we'll have that going forward. But just the first month alone in 2018, when we implemented it, we had 33 people utilize it the first month, as you can see on the utilization slide, and then it continued to grow. And then January we had a dip. I don't know why, but maybe because people were off and they could go see they were off for a little bit of time in January. They could go see, but there was a little dip. But for the most part, the winter months when people are ill, it seems as though they're utilizing the teledoc. And we continue to promote that through all of our wellness program, health fairs, our newsletters, that sort of thing. It's on our benefits online system. They can see that they're able to go ahead and register for teledoc. So we're trying to promote that as much as we can. And again, it's not for a replacement of a primary care doctor. It is just for if you are sick and just need that prescription. Yes. The next slide, we implemented the Florida School Retiree Benefit Consortium. We brought that to you last year, and we also brought it back. We saw that there was $1 million savings when we are going to go to this, so we should see that savings in 2020. This is for the 65 and older retirees, Medicare eligible, who will move over to the consortium. There are 15 other school districts that participate, and they will start that. We've already sent our first letter out to notify the retirees that this is coming, and they will get another letter as well as in September. They'll be notified just to continue to let them be aware that it is occurring. And then in October, we're going to have informational meetings at STC. 3 of those on October 18th to be able to educate the retirees on their options. We've expanded this to all retirees, those who are on our medical plan and those who are not. We sent letters out to over 2,000 Medicare eligible retirees, and we also captured the 64-year-olds because we wanted to let them know that that would be coming, so we sent that out to them too. And so, they will be enrolling in the plans in October for the January effective date. They will be supported with a customer service line who will assist them in enrolling either online or over the telephone. And with all their questions, they'll have plenty of help to get them through it. It's quite daunting for Medicare to shop through the Medicare supplement plans and the Medicare Advantage plans and the prescription drug plans. So it is a lot of information, and so there's a customer service support line that will help them get through this.
Have you had any feedback from anyone?
So no one has enrolled yet. They're just being notified. We've had plenty of calls when the first letter went out. Not quite as many as I anticipated, but a fair amount. And they've died off a little bit. The phone calls are just trickle here or there, but I suspect as more letters go out, it'll generate some more questions. People are anxious to see what's available. We've got a little sneak peek at what is going to be coming, and there's some zero-cost Medicare Advantage plans that will be available, and very low-cost Medicare supplement plans and the prescription drugs. So the vision plans, the dental plans will also be available, and hearing aid discounts and pet insurance. So those items will be all available to the retirees, and so I think it will be a good thing for our retirees.
Particularly if you have a horse. I have a friend with a horse. It was really helpful when she went to the University of Florida Vet School.
Moving on to the next slide, which shows our rate history, and you'll see we became self-insured in 2016, and prior to that you'll see significant rate changes when we were fully insured with Florida Blue, and a couple low changes. In 2012 there was a whole plan structure change, so that we reaped the benefits of that with rate reduction. But other than that, there was some pretty high rate increases, and since becoming self-insured we've done very well, and you'll see that this year we will have a 4% increase, and mostly due to higher cost claims that have come through. So it's still good. I know Paul has a comment. And
Eric.
Yeah, so when we look at the premiums, just roughly, how do they break out with how much is employee-provided premiums and how much is the school-provided premium? Just percentage, a rough number?
So
Like, is it 60-40, 70-30?
last year, 82.26% of all premiums paid into the district were by the school district, 11.79 by employees, 5.61 by retirees, and 0.34% were COBRA coverage.
So you're saying that employees are paying for basically 10% of the cost of the insurance?
So the employees who are on the employee-only coverage pay zero.
Zero, right?
Right. So there's
Okay.
over 80% of our employees are on employee-only coverage,
Oh, okay.
and then 20% carry dependents.
So the
And they pay.
11.79% in premiums is for dependent coverage.
There's a small
Plus the subsidy.
subsidy.
And I have a question for the Aon guy, but I'd like to hear him speak first.
Sure. I was just going to share some benchmark information on the renewal increase of 4% that Sarasota County Schools is looking at for 2020. We polled among our team here within the Tampa-Miami market 9 Florida school districts, and both the average and the median, ironically, increase for next year is 6.2%. And this is a mix of the 11, 9 are self-insured like you all, and 2 are insured. So that average of those 9, 6.2% versus your 4%.
Which was going to be one of my questions, just the comp rate industry standpoint, from just going from self-insured forward, just because that's where we're at, right? So, and I see the point where volatility's diminished since going to self-insured, at least so far it appears to be that way. So you're saying from a comp standpoint, comparable to districts that are, and you said that's self-insured and...
So out of the 9, 2 are insured, 7 are self-insured.
Okay.
So it's primarily self-insured.
Okay, and then that was a 6%?
6.2.
6.2.
6.2.
And how do you view our fund balance?
Well, we're going to talk about that in a moment.
Okay.
But the fund, in terms of what?
Are we right at track? Are we fully funded? Are we underfunded? Excess?
You have a margin. You have there's a requirement by the state of Florida,
Right.
11208. You have that, and then you have some excess funds, which we also see among peer districts, that there are excess funds equal to about a couple months of additional paid claims. That's consistent with what we see with other clients.
Now, when we take into account the 4% increase, I see that we don't normally budget for the projected year doesn't have the interest income.
Okay, so you've moved over to the next slide. So
Yeah, let's let them
Okay,
get
I
ahead
thought
of
we were on
ourselves.
7. No, we're not on 7?
No, we're not.
Oh, okay.
well, we can be if there's no more
No,
questions.
let's not get ahead of ourselves.
I think we're moving forward.
Is there anything else that we need to go into?
Okay.
Okay, now we're on to the updated financial analysis, Eric.
I see. I know. Typically, you've said that you don't typically include the interest rate in the calculation. Will that affect the 4% increase when we get the actual?
There is interest income included in the budget. The projected plan, so let's just kind of look at the graphic really quick. So the actual columns, the ones that list by fiscal year, so 17, 18, those are our actual results of operations, our premiums we received, and our claims. So, of course, you can see that the operating gain or loss was $5.7 million, which is why we stated we didn't need to necessarily have any kind of a rate increase, that we were doing great. So for this last fiscal year, we kept it at 0, and we still had a positive result. But if you look at the claims, you'll see they went up $6 million from the prior year. So it was a pretty substantial change. So I have some concerns about what we have budgeted for 1920 already, but it does include the 4% rate increase. You're not going to see a substantial increase in what you see as premiums because, remember, in January of 2020, our over 65s will come off. So that revenue is now also coming off, as are the claims. So we're hoping that the claims will be in line. They may be off a little bit, but you will see I do have budgeted interest income. You'll see in 18-19 it's kind of an anomaly because a lot of what you have to book as far as your actuals are book entries. They're not realized gains or losses, but they're based on the value of your assets in these funds. So that's part of why this number for 18-19 is so high in interest income. So if we're booking it and accounting for it already in 19, then as we realize it, we won't necessarily be counting it in 1920.
And the 4% is something we vote on usually around October timeframe?
It was,
Yes,
yes, she'll bring you the rate.
The rates will come in September. I didn't
September?
put them on for now. Typically, we do it in September. We're a little earlier than we were last year at this meeting because of some of the information we're bringing to you, but we will be putting the rate increase for September's board meeting.
And that's why this is a projected. I think last time when we did it, we had closed the fund, so we had actual. So this may not include some of the IBNR and some other things in there, but so then projected plan 2019 is what Aon had projected for us when we came to you for the calendar year, because of course our plan is a calendar year plan. So you're kind of working in two different realms, calendar year for the plan itself and fiscal year for the budget. So then 1920, you'll see even with the 4% increase, where we're projecting we're going to maybe break even. And if claims continue to increase at the rate with which they are, we may not. And of course, Aon has come up with their 4% rate increase and their projection for the 2020 calendar year. And as you can see, it's about a break even. So that's what this document states. And then the next page is where we start talking about fund balance. So if you want to go there.
Well,
Okay.
well, so 4% of 50 million is $2 million. And so where's that $2 million show up increase?
In the premiums.
In the premium. So where's the...
So it's going from 52,183 to 53,329, but we're losing our retirees. So it's not the full amount.
Okay. That was something that increased $2 million. That's why I was looking.
Yeah, we're losing the retirees' premiums.
For 6 months, half of the year. They'll be gone. So,
Do you need people to replace them? Are we getting employees to replace them?
but a lot of them may choose to decline because they have coverage elsewhere.
That's a good point, though. Are we seeing, are we seeing a trend break off? That's surprising to me almost, because I think our plans are very...
We do have,
good.
we just looked, and we have, from an old decliner program, we have 45 decliners left on that, and we have 145 people that decline our medical outright. So we have close to 200 total decliners.
I'm going to have a hard time, just personally, increasing rates on people who make, $9 an hour and they don't get a raise, and increasing their charge for their premiums.
But again, 20%, that's 20% of the population that has dependent.
I'm just telling you my personal feelings. I'm going to have a hard time on the guy who makes $9 an hour.
No, I agree.
Increasing, telling them that their net paycheck is going to go down.
Well, I also like to point out, too, that we pay 100%, where a lot of other districts, there's a cost share.
We have employees who work for their health insurance.
Right.
I mean, their total
But their
paycheck.
health insurance value is actually greater than their salary.
But I would hate for people come to work for the health insurance and not even have money to cover that.
Well, we've had that for years.
Well, we also...
And I don't like it.
Well, and
I know.
our plans are so expensive because they're so rich. You go to a lot of other districts, and their plans, their actuarial value of their plans are less. Our
And-
lowest plan is 5% more.
And we may have to look at that again.
Right.
Because, we may have to look at our rich plan because it may be too rich. I mean, I think that it's been great that we've had these options, but other school districts are not doing that. And if we become penalized because we're doing that, and that could happen, then I have concern.
Okay.
So before you go to the next page, I just want to continue on that line of thought. If we do not increase premiums, is it as simple as adding $2 million to this $8,000 negative so the plan runs $2 million in the red
Yes.
for the 20 plan year?
Mm-hmm.
Okay. And
It
so
won't be 1.1 million. It'd be 2 million.
2 million.
Why does it go up 2 million when you don't increase, but it goes up 1.1 million when you do increase?
wait.
I'm confused.
It went from 5.21 to 5.32.
okay, so
But
what
now
happens
Those,
is
those,
it
those
went-
65 people would still be coming off.
I'm going to have
so
both the
it
loss
goes
of
up
the-
2 million, and then it comes back down $1 million. And so if you're not going to allow it to go up to 2 million,
It's still going to go back down $1 million because those 65 people are still retiring.
no, you're going to take it back 3 million.
But those 65 people are still retiring. They're still coming off the insurance, whether you increase in premium or
You
not.
refuse to support a $2 million rate increase, $2 million comes off of the premiums. It's basic math.
But no, she just said it's not the whole $2 million because some of it's because the 65 people are coming off.
No, I don't get the full $2 million because I have, say, $1 million coming off, so I net $1 million. Well, now, if I don't get the $1 million from the 65 premiums and I don't get the $2 million, I've lost $3 million. So I will take the full $2 million off.
Then maybe we should at least give $2 million in raises then.
Okay. So if you go to slide 8, you'll see the reserve calculation. There's a statutory Florida Statute 11208 that requires you to have on hand at the end of a fiscal year. I think it is 60 days worth of projected claims or incurred claims. So in 17-18, you'll see that we had a fund balance of $14 million, and we actually had the operating gain of 5.7, which put us in a great financial situation. We're sitting there with $19 million. Our incurred claims were 43, so we had the $7.1 million fund requirement, and it brought down the amount of money we had available, because remember, we borrowed from Fund 3, $6.8 million. So it had $12 million sitting there. I was not yet comfortable taking more than half of that amount of money away, particularly when you saw $6 million increase in claims year over year. So then you go to 17-18, that carries forward the $19 million. We also are projecting to have an operating gain of 1.9, which takes us to 21. Again, now our incurred claims are substantially higher, so our reserve requirement is higher, which leaves us with $13.5 million. Going forward, this next slide has an issue. There's a change that needs to occur, so I'll just kind of walk through it with you. But you carry forward your $21 million fund balance. We're projecting a small operating gain, so we go to $22 million. We have incurred claims projected at $50 million, but the fund reserve here was calculated based off of $47 million because that's what was in the tentative budget. But once we actually started looking when the fund was closing and the final bills came in, and we knew this year we were going to be at close to $50 million, we couldn't use $47 million as the amount. But that's what is in your tentative budget currently. Yes. So this number has been changed to 50, but the 7.8 is calculated off of the 47 million. So this reserve requirement is actually 8,333,333. Which takes the amount available to repay down to 13.6 million. You repay the funds and you end up with, it's basically a 50-50 split, so we would end up with 6.8 million.
But if you delayed paying back the funds, if you paid half of the much,
Yes.
that would be more than the $2 million. Half of 6 is more than 2, right?
I'm dumbfounded, so I want to ask a clarifying question. Are you suggesting that in lieu of a rate increase?
No, I'm not.
Can I finish my question?
Yes, sir.
Are you suggesting that in lieu of a rate increase that we draw from reserves within the insurance fund?
No, that's not what I'm suggesting. She was talking about we paying back the loan to the capital fund.
Okay.
Okay. All I'm saying is we should look at all of our options.
But if you delay repaying the loan and you do not do the 4%, are you saying that that $2 million comes out of the reserve?
No, what I'm actually saying is I think we should give raises to the people who make the least at the school district.
Great. Where do you think that comes from?
I think that we should cut some from administration, but I think it's outside the scope of this discussion.
It is certainly outside the scope of this discussion, please. So let's not do that.
I'm not campaigning. I'm worried about people.
Okay, so basically, if we're going to have a discussion about not having a rate increase, then we are talking about a $2 million operating loss in the fund for 1920, which would then reduce the amount of fund balance available to pay claims or for the 11208. Is that, if that's what we're talking about, if that's what you'd like to do?
Of which we benefit 80% of. And so of that $2 million savings and rate increase, 1.6 flows to the district, 400,000 to our employees, correct?
Correct. That is true. Actually, it's only 11% because you have retirees and COBRA coverage. So it's only 11% of the 2 million would flow to the employees. That is a true statement. Okay, I'm done.
Okay. So now we're moving on to slide 9, and we're going to change out, and I'm going to bring up my extended team members. Thank you, Paul and Mitzi, and bringing up the Tryon team, Ellen Butcher and Donna McClellan.
Good morning.
Good morning. Thanks for having us.
There's your mic. Okay. So another topic of cost savings, I wanted to bring to you pharmacy. Pharmacy is quite expensive for the plan. As you can see, the 28% of total claims expense comes from pharmacy. That's over $13 million. And a lot of that is due to the specialty drugs. They account for 41% of the pharmacy spend and only 1% of the pharmacy claims. So again, another high cost driver for our plan is pharmacy. Some of the top drugs that are specialty drugs are for the autoimmune diseases, cancer, and hepatitis C. So that's what we're looking at. The plan does realize savings through utilization management with prior authorizations, quantity limits, and step therapy. So there are things in place to help, but we're bringing to you some potential options for additional cost savings. In 2017, I brought on Tryon as a pharmacy broker to help with containing some of our costs. And I'm going to let this next slide, let Ellen Butcher speak to what they have done for our district and the savings that we have seen by just renegotiating our pharmacy with Florida Blue and Prime.
Good morning, everybody. So Tryon has a prescription drug coalition. And what we did for the school district is we used the improved pricing terms that we get through our own coalition. We leveraged that to negotiate with the Blues, with Prime and Blue Cross Blue Shield, to actually improve the contract and pricing terms for the school district. By doing that, we saved the school district just under $1.2 million, and that was no change to employees, no change in co-pays, really just improving the contract terms so that the school district got better pricing. So that's summarized here on page 10, showing what your cost would have been had you done nothing, and then what the costs were by renegotiating the contract with the Blues and the savings that was achieved.
So the next slide, if you recall last year, we brought a similar slide that showed different options with pharmacy for cost savings. One doing some mail order, some requiring a particular chain. And so we went back, we wanted to look a little deeper into other options, and these options, some do cause disruption. So we wanted to look at that with our actual claims so we could get a real number on who would be and how many people would be affected and what options we would have available for some cost savings. So with this, if you're looking at slide 11, you'll see the current program with Prime, and we are considered carved in. Our pharmacy is still with our medical plan. You have an option of carving out and bringing your pharmacy outside of your medical plan, and then you have more control over what goes on and the controls in place for that. Without doing that and keeping it there, Florida Blue, Tryon, and it renegotiated, as they told you on the previous slide, and we saw significant savings. They went back to them again this year to get what else can we do, leveraging the coalition's pricing. Florida Blue came back with, well, if you do nothing, they could save us $200,000 off of it. Then they came back with some other options, and you'll look at bullet 5, 4, is it 4? 5. Bullet 5, or number 5, you'll see that they also came back with, well, we could limit your pharmacy. We could totally exclude CVS, and then you can have every other pharmacy, but the savings was just $300,000. Then they came back with also just having a Walgreens. Well, that would be significant disruption. So that was not a whole lot of savings, but those were things that Florida Blue came back with. And then if you look across, you'll see they also came back with the net results formulary. That was a significant savings. You can see that it's $1.4 million savings with less than 3%. Sorry, I don't have my glasses on. I think it says less than 3%. Disruption. But they introduce a different tier structure. We currently have a 3-tier structure for our pharmacy, and those are the brand, the generic, and the non-preferred brand. We have a $20, $40, and $60 copay. That's our structure. They came back with 6 tiers. And what that would do, in order to see those savings, we would have to actually add 3 more tiers of copays, and we're actually not able to do that because our copays are in our bargaining agreement outlined, as all of our plan designs are within our bargaining agreement. Unless we bargain that, we can't change our copays. So that particular option, really, we can't even do at this point in time. We would have to renegotiate in our contract. Also, the way that they can,
quick question on that. Just an overall, and I think I know that you have the disruption component, and I just want to know, because you talked about the cost drivers, and I understand people with Crohn's and what have you who have those autoimmune diseases, and those are critical prescriptions. And so I whatever our plan forward is making sure, because I think on page, the one before it was, 2 pages before that was quantity limits and all of those things. So I just want to make sure we as a board are clear on what those limitations, if we were to go in any direction, because those can be.
And we'll get there.
Okay.
We're actually going to address that.
Okay.
We're not looking to disrupt someone who has a very serious illness. That wouldn't be disrupted. Okay. The disruption is more the massive maintenance, diabetes drugs, that sort of thing, that there's a generic alternative.
Okay.
Yeah.
Okay.
So just going back to the net results, their disruption, the way they calculated, they only looked at 4 months of claims. In their eyes, that's how they feel. We only have to look at 4 months, and that's capturing the disruption. We need to project our savings. Tryon has a 12-month look back. They look at 12 months of claims to capture a better window, and that's how they've calculated their disruption. So there's some question on whether or not we feel that that is really a valid disruption, and it's at least what I think, and I believe Tryon, they agree too, that that's not typical. Typical is 12 months. So those numbers we're seeing, I don't know how true they really are from Blue Cross, the net results. So moving over, Tryon has a coalition, and I'd like to have Ellen explain what it is, the coalition, so that you understand that. And they mirrored our current structure with the 3 tiers, so that there's no change in that, just in the pricing and the discounts that are received from the way that they work with Express Scripts and Optum, who are 2 pharmacy benefit managers.
Yeah, so what our coalition is we actually leverage our entire book of business and all of the lives in that business. So rather than just looking at the school district with about 7,500 covered members, we've got about between 250 and 300,000 covered members in our coalition. So just by the nature of that volume, we're able to negotiate better drug discounts as well as drug rebates through both Express Scripts and Optum Rx. We also have coalitions with each PBM, Optum, and ESI, also trying to leverage one against the other so that we're always getting the best pricing on behalf of our clients. The beauty of the coalition is that you do get the improved pricing by having the larger volume, but you maintain autonomy and control over your plan. So you keep your plan design the way it is today. You don't have to change copays. And your plan is separate from the rest of our coalition. We're just using the lives to negotiate the contract terms. We're also looking at very specific contract terms so that we're making sure things like how often rebates are paid and the timing with which rebates are paid back to the school district is favorable to you. So it's not just looking at the discounts and the rebates, but also all of those very important contract terms that impact your net cost. When we look at that, between our Express Scripts and OptumRx coalition, you'll notice that the savings with OptumRx is more significant than the savings with Express Scripts. It's at the end of the day, it's completely your decision whether you make a change, and if you do, to which vendor. One thing that we think is very important to consider, as well as the savings, is the disruption to your employees. And you'll see that with Express Scripts, the disruption is around 5%, and it's important to note that that 5% is negative disruption. So members that would either, based upon the prior 12 months of claim history, pay a higher copay under the Express Scripts formulary, or their drug that they were taking is now excluded under the Express Scripts formulary. You raise a very good point in that we want to make sure that those drugs that are either disrupted or excluded are not drugs for someone who is being treated for cancer or someone with Crohn's disease that's taking a specialty drug. Those specialty drugs aren't often in that disruption because there's no alternative. So when we look at the disruption, those are drugs that have alternatives, and they're either lower cost brand name alternatives or generic alternatives. So they're not those more critical drugs that you don't want to disrupt those drugs.
So when you say no disruption, I mean, even so, not say, but because I've seen certain plans like this where they'll cap. So would that be included as well for those specialty drugs, for example?
I'm not sure what you mean by cap.
Like they would limit the amount, I don't know, they would limit the frequency or the amount that you can have. And so I just want to make sure.
Sometimes they control the amount so that you don't get too much and find out that it doesn't really work, because sometimes they may be taking a drug that doesn't agree with them and they have a reaction or something like that. So if they prescribe too much, they've now wasted the drug. So
right. Well, no, I get that. I just want to make sure the disruption is, like you said, those specialty drugs don't have alternatives, but within that disruption, it's not saying, I'm not, this is not my area of expertise, but I'm just familiar that there can be, it may not be a direct disruption, but it still can have that impact. I just have known too many people with those medications that have found their insurance all of a sudden is no longer covering it, and these are specialty drugs. So I want to be very clear if that's something we would be facing.
We shouldn't see that happen, and part of the reason is our assumptions take into consideration the clinical programs you have in place today would be duplicated as closely as possible moving forward. So these programs aren't saying things like that, where now you're limited to certain quantities or frequency with which you can get the drugs. This is really saying, based upon your prior utilization, and if those utilization patterns continue, then this would be your expected cost. It's really the discounts and rebates that impact the net cost that will achieve that savings.
Right, and we're talking about formulary disruption. So a drug that is a formulary drug today that won't be a formulary drug under ESI, but has an alternative. And as Ellen said, a lot of them are your maintenance medications, more around diabetes and things like that. Keep in mind, you have formulary disruption every year with your current vendor because they change their formulary. So there's always some formulary change throughout the year regardless. Specific to high cost drugs though, and the specialty, because it was an important question that you asked. As Ellen said, there are no alternatives, so it's going to be covered unless it's really deemed not medically necessary, which, okay. But the other thing that we'll be sure to make sure we manage on your behalf, I'm sure we're looking at it on the medical side as well, is with a lot of these high-cost drugs that sometimes require infusion, the site of care needs to be managed. So is the infusion being done in the hospital? Is it being done in an infusion center? Is it being done at home with home health care? Those are the kind of things that our clinical team will look at when we look at the prescription drug utilization on the medical and the drug side to ensure that the plan's not paying for a higher cost site of care when it could actually be infused at a lower cost of care. So we'll look at those kind of things. But yeah.
With regard to disruption, I'm sorry, go ahead.
I'm curious, this is actually a question for Lynn. How does Teledoc's history of price increases compare to Blue Cross Blue Shield's prescription program increase? I mean, obviously there's savings, but if Teledoc's has a history of going up 10% and Blue Cross has a history of going up 5%, then we're not going to accrue the savings over a long time.
So I think it's completely different, and Teladoc is the medical side, and then if they go get a prescription, it still falls under the prescription plan of the medical
I see
plan.
Blue Cross Blue Shield costs more than the Teladoc.
Teledoc's part of our.
I'm trying not to say Teladoc.
Yeah,
Tryon. I'm sorry. I had a brain fart. Tryon.
Okay, because I was confused.
I'm
by
sorry.
what you were
I'm sorry. I'm sorry. Can I rephrase my question?
Yes, you may.
Does Tryon? What's the history of Tryon's increases
That's a good question.
over time versus Blue Cross Blue Shield's increases over time? Does that make sense?
So Tryon's coalition price increases.
Correct.
So I'm gonna.
Because right now we're realizing the savings, but in 3 years, if Tryon has a history of growing at a faster rate than Blue Cross Blue Shield, then that savings would evaporate. So that's why I was just asking, what is the history?
So the history.
Does that make sense?
Yes, you're looking to see, is there going to be an end to that savings?
Right.
Are we going to hit the end of the road? And I asked the same question, and they haven't seen the end. So they continue to see savings as they negotiate.
Yeah, ESI or Optum is the PBM, the pharmacy benefit manager. And so they're dispensing the medications, they're managing, your drug spend. They're dispensing the specialty, mail order, all of that. You get your retail at retail. But where Tryon comes in is we negotiate not the cost of drugs, but discounts off of AWP, rebates, and things like that. And our pricing terms continue to increase year over year. So the projections that we're showing you for a 3-year period are based on our 2020 pricing terms with ESI and Optum, but understand that every year we're renegotiating with ESI and Optum, and as our pricing agreements increase, higher rebates, deeper discounts, you're going to be able to take advantage of those in 21 and 22. So our projections are based on 2020 pricing. They will improve in 21 and 22, and you'll take full advantage of those price.
I would like to, just so that you can follow along, I gave an appendix out to each of you, and if you will open up the appendix, it's probably at the bottom. It's not attached to the. Did you hand it out, Kathy? Yes. Okay.
We have it. It was given out this morning.
Literally named appendix. Here, I have like a stack of paper over there.
So if you look at that, the first slide shows year after year what is projected guaranteed savings from discounts and rebates. This is because they've already negotiated savings, and then they'll continue. So these actually could even get better.
Yeah.
And you can explain that a little better.
It's a conservative estimate based upon our current pricing terms, but as Donna said, each year we negotiate to improve our contract terms and pricing terms. So this is kind of a baseline savings, and we would expect that to be slightly improved year over year based upon our contract terms at that time.
And are you negotiating with the PBMs?
Yes.
Yes.
I just want to make sure.
Yeah.
Yes, not pharma.
Right.
With PBMs, right.
Can you do that? No.
We'd love to.
Right?
The other thing we'll ensure is that you do have guarantees, pricing guarantees. We will reconcile all of that at the end of the year. We will take all of your data. we will take a look at, the rebate structure that's in force today and recalculate it to make sure that you indeed were paid the rebates by your PBM that were due you. And that the discount guarantees, because they're based on what your utilization looks like today, a snapshot in time, will reconcile those. And if there's, if there's, they're under the amount of the guarantee, we ensure that all comes back to you. So we're going to reconcile that on your behalf.
Also, as your coalition increases in members, that will also give you better buying power.
Yes, correct. Yes,
We've seen
correct.
that happen over the years.
Yes.
So to your exact question, when we see the Blues, their trend, I'm just going to use approximate numbers. Let's say their drug trend over the years has been like 10%. Well, our coalition trend might be between 6 and 8% compared to where.
Yeah, that's what I wanted to
is.
know.
Right.
Yeah.
Typically, it's lower, a couple percentage points below.
I just want to make sure yours wasn't higher because
No, yeah.
in the same direction.
And the other advantage that you don't see in the numbers to just carving out your prescription drug program in general is that you're now able, to Lynn's point and her team, talking about wellness, knowing where your chronic conditions and high-cost claimants are being driven from. You have the ability to look at your own utilization, know where your drug spend is and the trends within your drug spend, and work with ESI or Optum, whoever the carve-out PBM is, to then better manage where your high utilization is occurring. Whereas today, whatever utilization management program that's in place for the Blues' full book of business is how they manage your own school district's claims and utilization. So you'll have much more flexibility. You'll be able to target specific areas within your drug plan and manage it accordingly, whether it be, a pre-authorization requirement or step therapy or quantity edits. You can do that at your discretion rather than primes.
Well, and so I understand the function and control because I think it's more customization based on our pool.
Right.
But I believe, for example, Lynn has a lot of other, as you see the packets that we're going through today, that's all under her department. What's the administration look if we carve it out? What's that burden? Is that something you guys do, or is that something the district's going to be incumbent upon being prepared to manage?
So we would facilitate the implementation process, and through the implementation process, one of the things that we would establish is feeds that would be exchanged with your eligibility vendor, so that the electronic eligibility would go directly from, whether it's from the school district or if you have a vendor that does that, or from the Blues to ESI or Optum. So member information is getting passed. And then we would also establish claim feeds so that the Blues and Express Scripts or Optum could share claim data to help manage the claims.
Do you need a TPA or something like that to manage something, or no?
No, that would be through Florida. We would be able to contract with Florida Blue as part of a fee for them to feed the claims through, and ESI or Optum would be the pharmacy benefit manager. And then Optum, Tryon would be the consultant.
And oversight. Of ESI.
Well, I've personally had some issues with prescriptions that were new to the market with an eye condition that I have, and found it a little difficult, a little expensive for my share of it. I've also had a problem with Florida Blue not paying for a medical procedure that I just recently had. So, it's been challenging, but I am now moving into the arena, shall we say, where I am seeing some of these things and having to go to a special pharmacy. Medication I'm using is refrigerated, so there's some issues with that and so forth. So it's been an interesting year. I'm glad that I have a medical savings account because that's really been utilized fully this year. But it's interesting, and when it's your eyesight and it's something that's as many of these processes and conditions are, it's been awakening for me because I've had great health all my life, and this is the first time that I've had to go through the challenges of trying to get special attention or chatting with somebody. Lynn's been really great to help me through this process.
One question I have, and I know this may be getting ahead, and perhaps it's a pivot over, but you had mentioned that one of the options wasn't an option truly because of the current contract language. Is that
Net results.
yeah? Okay, because I was on the copays that are
That's
Spartan.
correct.
So, and that's the only one. So basically I'm saying, obviously there's an ongoing negotiation going on. So are there any others that would be a disruption or be in contradiction of the current language, so that would hold us off on taking action?
No, that's just that one would add copays, so that would be a problem. So I actually would like to go on and talk about the disruption so that you could get a little bit more flavor of what we're talking about and how many people fits into that percentage. So if you look at the appendix, the first one is the prime net results that we're really kind of going to glance over because we really can't talk about that right now, but it is some disruption there for you.
Let me just kind of get a feel for the board. We're about 15 minutes over, but I know you're kind of up against October 1st deadline to make some decisions here. Continue the conversation at the expense of some other agenda items. I mean,
think
we're
so.
knee deep in it, and we've got the people here.
I think so.
And for me, all I want to hear about the disruption for the Express script.
That was my next question. If
That's
we
where
could
we're
focus our comments, it seems like on the
We're get-
express scripts. Yeah.
Yes, the Optum has higher disruption. I think we should focus in on the Express Scripts, and we can go over that disruption right now.
Thank you.
That's on page 3.
Yeah. If you focus at the table at the bottom of page 3, I'll walk you through this. There's a lot of numbers here, but the way that I have this structured is the first section, there's a red bar around that box, and that's where you'll see negative disruption. This is page 3 of the appendix.
I'm in the stack here.
I think we have them in the back. We have one more set of the appendix. So you can take notes. That's okay.
I'm fine with sharing.
This was given out this morning.
Oh, was it?
Yes, it was put it on your desk.
Yes, in the packet with the job org charts and
Oh, I love org charts.
This is great. Can we get this color?
You can.
Go ahead.
Okay, sorry.
Get you some crayons.
Thank you.
Go ahead, I'm sorry.
all right.
That's okay.
Go ahead.
So the negative disruption is when someone is taking a drug that's on the current PBM formulary and they're paying your brand formulary copay, which is $40, and that drug on the new PBM formulary will not be on the formulary. It's considered non-preferred or non-formulary. So then they would be paying the higher copay of $60. So again, there are alternatives. So they could work with their physician to find an alternative and keep that copay where it is. But if they didn't, they would be negatively disrupted. There 1.3% of your members, or 126 members, would fall into this category. We also show this in terms of the drug cost and the number of prescriptions. I think it's also important to show that there would be positive disruption. So in other words, someone's taking a drug today where they're paying that higher $60 copay, and under the new arrangement, they would be paying the lower $40 copay. And that's actually a higher percentage. You'd have 7.2% of your members, which is 702 people, that would drop down a category and pay a lower cost for their drug. The majority of people will see no change. However their drug is covered today is how it would be covered under the new arrangement. Now, it's also important to point out the last category of not covered, that's in italic print. Every formulary has drug exclusions. And again, those are drugs that are excluded from the formulary and considered not covered, but all have alternatives. So there are 3.1% of your members, or 297 individuals, that would see their drug not covered under the new arrangement, but could seek an alternative. Through the
For comparison, you mentioned, even if we, in our current structure under Blue Cross, whatever, there are annual changes as well. And so from one year to the next, some of our members will, in fact, have a disruption no different than this.
That's correct.
Okay.
Yeah.
And through the implementation process, we would try to manage this, and we would get a historical claim file from your current PBM and identify the individuals that would be impacted by this, and they would receive letters saying this drug that you're taking would be covered at a higher copay or would not be covered at all. However, here are 3 alternatives. You can see your physician about getting one of these alternatives rather than the current one. You can also, what we call grandfather. So if someone is taking a drug that has an alternative, but they can only take that drug, they've tried the others in the past and it doesn't work for them, or they had an adverse reaction to it, they can be grandfathered to take the drug that they've already been approved to take.
But if they're taking a drug that has no alternative,
Then that would not fall in. If
That
there's
wouldn't
no
fall under-
alternative, it's going to be covered the way it was covered in the prior arrangement.
Did you factor in grandfathering in the $1.2 million savings, or does that decrease some of that savings in the early years?
It could diminish your savings slightly if
And
we
we
would
could actually
grant-
show you what that is. If we, dug into the data, we can certainly calculate that for you. If grandfathering is something.
And does the $1.2 million savings include any costs we have to pay to Blue Cross Blue Shield to administer the program?
Yeah, it actually shows,
Yeah.
we will have, yes. Okay, keep it quiet, keep it quick. It's a net. Okay, so are there any other questions on the options? There's another on slide, I think it's like almost the last page. It'll show you the actual drugs, the top 10 drugs that are not covered, and you'll see for the Express Scripts, a lot of those are diabetes. We have a lot of generic diabetes that are free to our, as part of our wellness program. We offer the generic and hypertension drugs free to employees. So you can see that there's not a lot of, there's no specialty on that list of the top 10.
And a lot of these are the diabetic supplies as well, rather than the drug itself. But
Simbranza. Yep, it's on there.
Okay, so I just bringing this option to you. There is it's disruption is disruption, and it's going to cause people to have to make a change. To me, it looks like the $1.2 million is significant. Just want to know from the board, is that significant savings the board would like to capture, knowing that there is a disruption? Is there direction for me with what to do with our pharmacy program?
I'm okay.
I'm not sure what okay means. You're
Yeah, I'm questioning, what does that mean?
I agree. I concur.
With
with
moving
switching
forward.
to Express Scripts.
Correct. What Lynn just said. I was trying to be
Concise.
concise.
My only thing is, I agree. I think a carve out makes a lot of sense, and I have experience with Express Scripts. So, but my thing is, and it's not, doesn't seem like a significant number, but to those individuals, it's significant. So, how do we communicate that? And you said that was a very proactive component.
targeted communication.
Okay,
Yeah.
Absolutely.
That's my big focus, though. I would be okay with moving forward then.
And that was the same last year when we moved over to the PPO options. If you remember, there was some disruption, and those members were communicated that disruption would be occurring. So just being aware of it ahead of time before you get to the pharmacy. And my colleagues here were saying that sometimes if you get to the pharmacy, things happen behind the scenes that the customer doesn't even know about. They see that the drug isn't even covered, and they get on the phone with the doctor, and the doctor changes it behind the scenes. So those things do happen at the pharmacy.
Well, I'm okay with going forward, but you and I will have a chat offline about some of my issues. But I'm happy to go forward if this will save us money and it's easy for our employees to adapt. I think that's a good thing.
Okay.
I'm sorry. No, I do have one question. I just keep hearing about how insulin is being an issue as far as that, and is that included here? That I see it here. So that
in terms of some that are being excluded,
yes,
or disrupted, yes. And again, that's it. there are alternatives.
Okay.
But if those alternatives, if the person can show that they tried the alternatives, there are ways to grandfather that person under to continue taking what they're taking.
And that's what you were saying you could evaluate into.
Yeah, there's
Yep.
always an appeal process.
Okay.
And, if someone's experienced an adverse, reaction or what have you, there's
And do they
always
go
an
to,
appeal process.
who do they, if,
They go to the pharmacy benefit manager.
okay, all right.
I thought insulin was a pretty popular drug.
All right, anything else?
And nothing else with the pharmacy?
No, but before we conclude this agenda item, I do want to bring Mitzi back up and have a conversation about a premium increase and what this
Yes.
might do to that.
Okay, and also, the last slide does show that there's no other benefit changes, and we will add a debit card to the flexible spending, so.
Thank you.
Yes, so you'll see that.
Okay.
Thank you.
Thank you. Thank you, guys.
Thank you very much for being here today.
Thank you.
You want some more water?
Mrs. Corcoran, a name we love.
Be nice.
So if we could return to page 7 of the original presentation.
Yep. So again, I think what you would see is a reduction in the amount of claims. Correct.
In the amount of 1.2, but only in the plan year 20, you'd get the 1.2. You'd only get half of that in the 1920, correct?
Correct.
Okay.
If that much, because we would be just moving over. Right.
Right, and there is, for the rebates that we get and the discounts you'll see right up front, but rebates, there's a lag. So that would come a little bit later.
Months.
Well, that's with Florida Blue, but not with, it's 3 to 6 months
Okay, good.
with these.
Okay.
Better.
So if we take the claim number of 53.8 and we reduce that by 1.2, and I charged you with operating gain or loss, zeroing that out, we're looking at 2% or less, right in the 1.8 to 2% range. Is that correct? Okay. And so that's the conversation, because that will also be part of the package that returns to the board, is that currently we have priced a 4% increase. By doing the carve out on prescriptions, you realize a $1.2 million savings. If your goal was to simply have a zero operating gain or loss, you could reduce that below 2%.
That's
Correct.
good.
If the goal was to not have a rate increase, then you would have ballpark of an $800,000 operating loss that would be recurring, that at some point would have to be recaptured. Okay, so that's the options available to the board, and I'm going to need some direction from you. So to be clear, you're advocating 0% and incur an $800,000 loss to the plan. 0%.
No, I'm thinking that we need to look at more opportunities. I don't think that sometimes things aren't binary. I think that just looking at it right here, that looks like the only option. But sometimes when you think things through and you look at all the options, some of the things percolate up.
I think that you all have looked at all of the options and you're bringing us today the best options for us. That's what I'm assuming.
Yes,
And I know
we're
about assuming and breaking the word up, but still.
what we have available to bring for cost savings, I'm at the end of the line with what I can do with the current restrictions we have in place with our plan designs.
Okay, I'm fine.
Then I think we look at this and go forward.
Yes.
So I'm in agreement.
So to be clear, that would be
2%.
or less, right, in that ballpark.
Yes.
I think it comes in under 2%.
Under 2%, 1.99, no.
Yep. Okay. Ms. Siegler, Bridget?
No, I concur. I mean, like I said, I think if you have to, I want to go as close to zero as possible, but I do know that there's a lot of things to manage, and knowing what the market's driving, and like I said, the comparables are being important, so I'm fine with the 2%.
I think we're in a great spot if we come in under 2% compared to a 6.2% benchmark. Okay, so you can expect an agenda item sometime in September, and that gives you time to do open enrollment starting October 1st because we don't have the burden of having to go to the print shop.
And it will be October 14th, so yes, we're all electronic, so we don't have to go to the print shop.
And that gives you plenty of time to communicate with those affected by the changes we've contemplated
That is correct.
today.
Yes, we'll there's a lot of people will benefit. So we will bring a contract to you probably one of the next September board meetings. And
Either of the meetings in
probably the
September.
second meeting.
Okay.
But you have to have the next meeting tomorrow.
Yes,
Are we
so
okay
that won't be tomorrow.
Bringing that directly to a board meeting, or do you want it returned to your agenda as a workshop item in September?
No, I don't think we need it workshopped again.
Okay.
And I'll have the final budget modified.
I promised you clarity before you left here today. Do you have clarity?
I have clarity.
Okay.
Thank you.
Okay, thank you so much. Appreciate it. Next up, we have a stretch break, I guess, but we're running late, about half an hour. So we've just missed the Emma E. Booker presentation. No. Next up, we have an update on Emma E. Booker with Chris Renoff, Edwina Oliver, and Dr. Bowden.
You're moving over there?
I am.
Are you really?
I am.
Oh,
Your microphone works over here. I know that.
Are we rolling on, or are we waiting for this?
We're going to get started.
So good morning. Great to be
Good
here
morning.
this morning. Thank you for having us.
Thank you for being here.
You bet. Got a couple of special guests. Obviously, the proud principal of Emma E. Booker, Ms.
Yay.
Edwina Oliver.
Yay.
And our superintendent, Dr. Bowden. Dr. Bowden, before we begin, are there any comments or thoughts you'd like to share?
Well, when we got our school and district grades this summer, we were a little bit surprised with a D grade at Emma Booker. It has been our practice as a district to bring in our D schools to meet with the school board. One of the conversations that I had immediately with Ms. Oliver is that as a district, we're not going to make any excuses about the D. We're going to hit it head on. We can certainly have conversation, and I've said very publicly, I do not believe Emma is a D school. I certainly believe that they serve a better clientele than that. I do not believe that Miss Oliver is a D principal. I do not believe that she works with a D faculty. But if we're going to accept A grades from the state of Florida and celebrate those, we must also accept D grades when they come from the state of Florida. And I told her that when she presented to the board that it would be RD. And so that's the reason that I come before you today, sitting with Ms. Oliver, and we're going to talk about our plan for Emma and making sure that this D is a one-year anomaly.
Given that context, today we plan to first highlight the fact that great things, and I know you know that, but great things have been and continue to happen at Emma Booker every single day. So you're going to hear a little bit about that. Next, provide a snapshot of some areas of opportunity that the team at Emma, led by Ms. Oliver, have said these are the priorities that we really need to focus on. And finally, share a Reader's Digest version of a customized game plan that the administration, led by Principal Oliver, shared with our friends and partners from DOE when they visited last week. So with that, Ms. Oliver.
Good morning, everyone. And I want to thank the support of Dr. Bowden as well as Mr. Renoff, as well as my wonderful assistant principal in the back here with me, Mrs. Tia Henderson, who's one of our game changers for the 2019-2020 school year. And obviously, I want to thank my Booker Nation support of Dr. Rachel Shelley, who's here with me as well, because we're all in it together. So let's get started. As Dr. Bowden has already stated, we talked about accepting the D, and we have no excuses for the D. In a sense, we have explanation. It's a time for us to reflect. It's an opportunity for us to make systematic changes and to highlight the strengths that we need to design a more effective framework for our specific population which we serve. Success is not a secret. It is a system about policy and procedures, and that is what we're focused on this year as game changers at Emma E. Booker. So, all right, well, we'll continue on. And before you have a copy of the presentation about the details, and I want to talk about the celebrations that we have. We do have something to celebrate in with that letter grade being a D. We did make gains in our ELA achievement as well as our ELA learning gains. And that 7-point gain seems small, but that is a big number when we're talking about moving students who are typically at the bottom, in the bottom quartile, level 1 or 2 students. So that's a big gain for us. So we want to celebrate that. And that came with the support of all of our 3rd and 4th grade teachers from last year. And so we implemented a new program called Top Score, a writing program that we, Mrs. Henderson as the assistant principal, brought to our school district, to our school. So used by some of the teachers last year, you can see the increase in the scores with a number of levels of 8s and 9s from 18 to 2019.
And that's great.
Thank you.
Because writing is often something that lags behind other skills such as reading.
Yes.
So this is a wonderful thing.
Yes, so that we've agreed, Mrs. Goodwin, that's why we're celebrating that. But with that celebration came growth for opportunities. And as you see on there, our cohort of concern from last year was 5th grade. We did not make any gains in our 5th grade as a cohort. And when I spoke with Dr. Bowden as well as Mr. Renoff, when we met as a strategic support team from the district, we addressed those concerns there. And as we move forward for this year, our focus is going to be making sure that our big rocks deal with the small group instruction, and that we're dealing with making sure our teachers have the resources that they need to make sure that our children are receiving rigorous standard-based testing and assessments, that we're following the standards and we're assessing our kids on that from a standard-based perspective.
So beyond today's presentation, when you look at the performance of 5th graders at Emma E. last year, that cohort is now in 6th grade. They can be found predominantly at Booker Middle School and McIntosh Middle School. And so as we look systemically beyond the elementary school, we do have a cohort of concern. And so we are working with those 2 middle schools as they now have that cohort with them.
Right. And moving forward, what will it take? We have identified through our school improvement data where our target groups are, and it's students with disabilities, Black students, as well as our English language learners. And our school-wide goals, if you see there, they are very much achievable within this school year. But I must maintain, and I will continue to say, that Emma E. Booker is striving for the first A, and I believe we will get that A. And it's going to take the steps that we're starting now, this year, and things that we put in place even last year to continue to build that framework so that we can move there. So we are making our achievable A, and these percentages are just goals that will get us to a C. If we just did 50%, we would be a C next year. But again, our goal is to achieve the possible A at Emma E. Booker, and that is where our staff and that's where our students know our focus is, and that's what we're maintaining to do. With that comes some of our initiatives and the resources and the team that we will have in place this year to get that done. On this presentation, this piece here, only thing I want to highlight is that we want to focus on 2 areas. With our staff, the collaboration, the collective efficacy. We want to talk about the professional learning that we'll have with our teachers. So our 2 books of study this year will be the social and emotional learning, all learning, helping students to be engaged and develop those skills to be engaged students. And it's a book that Dr. Kingsley put out before the summer started with our teachers, and many of our teachers have already started reading that at Emma E. Booker. So I'm going to lead that book study with them to focus on the social and emotional learning. And we have Linda Daniels on board who will be focusing on high expectation teaching, because we know that high expectations, we say it all day long, but we want to know what it looks like at Emma E. Booker.
And that's a great thing that you have. She's a dynamite person.
Yes, she is. Again, I talked about our big rocks earlier, but with those big rocks comes the resources that we will need. So we're focused on social emotional learning, we're focused on small group instruction, and we're focused on standard-based teaching and assessing. So with our resources we have this year, we have introduced the Level Literacy Intervention, the LLI, and it's an intensive small group supplementary reading program for reading and writing for students with their ultimate goal to increase their reading achievement level. It's an engaging, it's a fast-paced program, but our teachers were trained on it. Many we have who are experienced with it, we have on board, and we have them trained. We started this summer with the training. We will continue. But if you come out to Emma E. Booker, you will see it full in effect. We started this week with it, and it's in all grade levels from K through 5. And with that, when I talk about standard-based, we have the LAFs and MAFs, which are the language arts standards based on our state standards for math and reading that we'll be doing this year, and that will be within small group guided instruction. Those are standards, assessments, and tasks based for Tier 1 students, but it'll make sure that our students are engaged and prepared for the statewide assessments when they come in the spring. We talked about the LLI, and Mr. Renoff will take it about our team.
So yeah, I'd like to just take a moment to speak a little bit about the team. The team charged at Emma with the design, the implementation, and the monitoring of the game plan is truly second to none. And that starts with the teachers and the folks that have been at Emma and are committed to the students and the community there. We'd be remiss, though, if we didn't take the opportunity to recognize and thank our friends and partners. And I'm not sure if folks typically refer to a visit from DOE as friends and partners, but they were out last week, and they really, really are here to support, not just in Sarasota County, but surrounding counties. But they came in and they really showered the Emma staff with, hey, we are here. We're not here to just look over your shoulder. We're going to roll up our sleeves and we're going to be here to support you as well.
Did they come because we asked them to? They came because they normally come for a D, or they came because it just happened to be serendipitously?
They came out of the Office of School Improvement because of the D. That's correct.
Because it's required.
And they did say Emma is a light touch school. So after they saw this version of the presentation, they walked away and said, wow, there's a lot of great things happening. Yes, we're going to help refine exactly what those priorities are so that, again, we love you. Thank you for the hospitality, but we really don't want to see you again. And so, but I just really wanted to say, I mean, honestly, they are great partners, Dr. Bowden, Dr. Kingsley, and there's so many others because the departments have reached out, the curriculum team, every department, finance, you name it, pupil support, they've given constant encouragement, they've been responsive, and the financial support. And I just wanted to talk a little bit about that financial support because, one, it helped, and Dr. Bowden initiated this one at the Welcome Back for the Emma staff. Teachers received some additional dollars in their individual classroom supply accounts, which really, really was well received because it gives them an opportunity to go and get some of the things that they desperately need there. They recognize that at Emma Booker, unlike some other schools, you don't just put a note out and get all of those resources immediately when you ask for them.
May I ask one question about staff?
Yes.
Are we fully staffed at Emma Booker? Do we have any long-term subs in the classroom?
We do have a few long-term subs in our 2 vacant positions. One is
2 vacant?
2 vacant positions right now. One is PE, and the other one is one of my ESC K through 2nd primary self-contained units.
And you do have, Ms. Oliver, I just want to confirm that you do have folks that you have had on your campus in those positions.
Yes, we went, 2 of the long-term subs have previously been at our school, or I've worked with them in the past at other schools, and they reached out to me when they saw the vacancies, and so they're there in supporting us through this.
Do we have any beginning teachers?
Oh, yes, we have some year 1 teachers, yes. We do.
And we're surrounding them with lots of love and support as well. And so, again, obviously, we purchased through the Restart funds that we talked a little bit about last year. We had some renewal and some rollover of those funds. And so Emma Booker has benefited from those as well for some really essential instructional resources. She talked a little bit about the LLI. Those are resources now that go right out to the classrooms to support the small group instruction. Social emotional learning, folks being on contract to really support the social emotional well-being of our kids, but also of the staff. Attendance support as well. We noticed a pattern, especially there in 5th grade and in kindergarten. We really need to make sure that those kids get to school. They're excited to get to school. I can tell you Ms. Henderson and Linda Daniels are very excited about that opportunity to go ahead and have some incentives for our kids to want to get to school. That additional assistant principal, that has not been on Emma's campus. So again, Dr. Bowden made that possible, and Ms. Oliver felt that Linda Daniels would be the perfect fit to come with those high expectations, come out of retirement and join that staff. And then we've hired 3 additional instructional facilitators, and those folks will work K2, and then 3-5 in math, 3-5 in ELA, working side by side, hand in hand, working and supporting our teachers directly every day.
So going to Jane's question was one of mine, is how many vacancies, and I know Dr. Bowden had shared that with me. So, but the new teachers component, and I think you just articulated some of the supportive services that are coming in on that. But what is that ratio? I mean, I don't know if you have that specific percentage right off the top, but
yes, I do.
You do, okay.
I can give it to you by grade level. We have our one new teacher, grade level, but she's from out of state. She's an experienced teacher, so she's considered year one in Florida with us. For first grade, we have 2 experienced teachers, but considered year one. Second grade, we only have 1 new teacher in second grade, 1 new teacher, but she's an experienced teacher from Duval who's with us. So that's only 2. Right there, that's our 2 new level 1, year 1 teachers. Fourth grade, I have 1, and in 5th grade, I have none, and I have 1 new teacher, year 1, go USF Bulls. He is our science lab teacher, Mr. Rodkey.
Okay.
And how many teachers do you have in each grade? Just second.
In each grade, I have 5 kindergarten units, I have 5 first grade units, I have 5 third grade units, I have 4 fourth grade units, and 5 fifth grade units.
No one can accuse you of not knowing your numbers. No, and I think that's important, and I think making sure of those new teachers, and I think it's important to highlight experienced teachers from out of state, but when they come in here, they're deemed new teachers. But Florida's a very different place than many other states, as we all know. So you feel that the supportive components for those teachers that you're putting in place.
Absolutely.
And that's a difference than last year. So that structure is different.
In fact, none of our schools have those instructional facilitator positions, so they'll be working directly with both Ms. Daniels, at the direction of Ms. Daniels and Ms. Henderson, and they'll be working side by side in the classrooms, modeling, teaching, small group instruction with the teachers.
And are we getting feedback from the teacher so we retain them, so we keep them
That's
there?
the idea.
Right, okay.
That is
good
our
stuff.
idea, but yes.
Thank you.
Right.
Yep. Alrighty, and so the next couple of slides really deal with the expectations that we have for our teachers and what they can expect from us. And you have a copy in front of you, but the only one that I do want to highlight is we continue to connect our families into our school. We'll be working on those foundational skills for math. We're going to go back to the basics and have students start working really on those basic facts so they can get that fluency up and be ready, so they're not spending so much time thinking about 8 times 5 or what place value and all that, those things that they can work on with their parents at home. And we're putting incentives in place so that we can continue to celebrate and reward our kids throughout this year. We want to keep them motivated, because what happens when the state assessment comes is it's not sometimes what they don't know, it's applying what they do know and feeling comfortable enough to stick with the stamina and to stick it out and to really put forth their best. And so we're going to continue to put these incentives in place starting now in the fall to continue with them, so to support our kids so they can feel comfortable and ready to take these statewide assessments, which are at grade level. Even though they may be functioning below grade level, we know that you can find success with small steps and putting the plan in place with our students. So that's what we'll be working on. And we're really focused on our small group and making sure that our teachers have the opportunity to pull small groups in ELA math as well as science, that they understand that we have to support kids at tier 1, tier 2, and even tier 3. From administration.
How successful was your summer learning?
We had a wonderful summer learning, and the reason it was wonderful is because one of my kindergarten class, I can tell you right now, everyone but except one student was not in summer learning. She has a full class. She had 6 weeks to start the year off, and when she came to us day 2 of the first week of school, she says, I says, how do you feel? How's it going? She goes, it's wonderful. This is the best year I've had. And she's from New York. We had her on a contract, a binder from about 2 years ago. She says, it's the best year I've had in my career. She goes, and we said, why? She goes, because I was able to spend time with my students 6 weeks in the summer. So I don't have to use that time to get to know them, to assess them. I know where they are. So that's the benefit of having Summer Learning Academy, even at kindergarten. But this year at Emma, we added 3rd grade. So we had entering 3rd grade, which we're seeing a difference. And if you were a teacher that was on board for the summer, we place students in your classroom, you have those students for this fall year. From administration, the only thing that I definitely want to say is about our teachers and the staff. They're very supportive of all of the support that's coming in from the state as well as our district, but they're at a mindset right now. My theme this year is being a game changer. We're going to change how we play the game at Emma. We're going to be more strategic about what we're doing. And with that comes new initiatives, the LLI, continuing with the top score, continuing with making sure that we have places and resources for tier 2 and tier 3 students. And our staff is very flexible and they're very open and they're accepting the positive change because they understand the direction in which we need to go. And as Dr. Bowden has already mentioned, I do not have a D staff. I am not at a D school, but I have to embrace the D that was given to us based on state assessment from the state.
But they are D determined.
Yes, we are. And on the other pages, it really deals with our progress monitoring. How will we assess our students and what will we be looking at? And one of the things that we will continue to look at is data, and making sure that we're looking at the iReady data, making sure that we're looking at the DIBELS and the BAS, making sure that we're looking at standards benchmark assessments, using our series with our GPS for math, and making sure that we're looking at all of our data to make informed decisions and moving students in the right direction and making the changes, not waiting until the first quarter ends, really trying to assess our kids more often and getting that information to our students and with our staff during our CPTs. When we meet with them once a week, we talk about the data and bringing student work samples. That was a missing piece that we did not have. Looking at actual work samples, we know as teachers and professions what they cannot do, but knowing what they can't do based on the evidence in front of you is a world of difference. You need to have the samples in front of you to say, here's what they're not doing based on the standards and where they need to go.
I have a quick question, just kind of as I consider the progress monitoring, this is more external, but going back to staffing, how many social workers and homeschool liaisons do we have?
I have one homeschool liaison that I have every day, all day.
Okay.
And then I have our district social worker that comes 2 days a week to the campus, which are district psychologists. So, yes.
Okay, thank you.
Mr.
Eric?
Robinson.
You can call me Eric. I don't know. So we talked a little bit about professional development, which I think is huge. We talked about giving you guys some books to read. I assume they also leverage the existing professional development staff that we have at our district. Is there any opportunities or in your budget to, if your school needs to go outside the county for professional development, do you have those type of funds to do that?
Oh, yes, sir, I do. I use and maximize our Title I dollars for that professional development. But even with the support of the Restart funds, we're able to do certain things within the district, but we are able to send our teachers outside. Last summer, with the support of Mr. Renoff and Kelly, we were able to send one of our ELA program specialists, Sam Hawks, with our team to learn about the Fontes and Pinnell, creating a literacy library in the side of a classroom. And that started our reading motivation to continue with Fontes and Pinnell and doing the things that's research-based to improve the reading achievement.
And since he's over there, thank you for giving her additional funding and additional staff. I really do appreciate it.
Me too.
Good job, Dr. Bowden.
What I would like to say is, community partnership schools are popping up thanks to UCF and the legislature acknowledging that this is a great thing. Manatee Elementary has been approved and is using this year as their year to make plans for next year beginning and being a community partnership school. So I think that we're all eager to see if that has a place in our community, perhaps at Booker Elementary in the future. But it would not take away from anything that you're doing. It would just enhance wraparound services and some of those other things that we know to be very important, not only to your students, but to their families. So anything that we can do to find out more about that, Dr. Bowden, Mr. Renoff, will be, I think, informative between now and next year. We missed the cutoff to do anything this year. Right. I guess we would have to actually apply and be accepted next year. Bridget?
As far as absenteeism, and when you said kindergarten and fifth grade, I know we have many community partners that help us in a variety of ways. Is when you dive into those individual cases, are we able, I'm confident I know we are able to identify sometimes what the issues are. Correct. That it is a myriad of complex issues, but are we, in general, can you kind of talk through what supportive services or where we tap into our community partners and how to help that child by child, if you will?
Sure. What happens is, like you said, it's a myriad of things, but we have the support in place for those students and those parents. And when the students are late to school or their absence, sometimes it is family issues that come up that we have no control over. But what we do is make sure that the support is there. We reach out to them. Our homeschool liaison will reach out. We do home visits. We connect. Our teachers call to see what's going on. And then with the support of the Community Foundation, the emergency funds, oftentimes oftentimes we are taking care of eyeglasses. We're helping with some prescriptions if they are needed because they're in between appointments to get renewal. We help with gas if it's an issue of getting the student to school because you don't have the gas, especially if they're a choice to us or they're on reassignment. So they're not necessarily near us. They may be a ways off, but they do come to the school and they will ask. Our parents and our families know who to reach out to at our school level, and inside at our school level, we know how to go outside to get the support that we need for our families. So we really give no excuses. We want to make sure that they understand we're here to support you, to support the students from the homestand so that we can do what we need to do when they're here from inside to support them.
Is transportation commonly an issue?
Not at our school. Okay. Most of our students either walk to school or their parents drop them off.
Okay.
So transportation in that sense is not a huge issue, but there have been like anonymous donors like last year that wanted to just pay the rent for one of our parents during the holiday season. Like, I want to make this donation, but can you pick a family out? And oftentimes we are able to identify that with our new social worker, our homeschool liaison this year. She's created a wish list based on the needs of the parents, what they give us. Where would you assess your needs? High, low, medium. And then she's able to gauge what type of support each of those families may need. And so when we receive those type of donations or funds, we're able to call the family, hey, do you need this? So we're trying to be more proactive rather than reactive to our family needs and trying to anticipate what they may need with supporting their students from the home to get them to the school.
And one final question, just hinging off that, I know you mentioned each school, sometimes teachers can put lists out and the families have the ability to get those supplies, and that it's varied school by school. Is that something that has maybe through a community partner can be shared so that members of the community would be able to tap into that?
Absolutely, but I will tell you, just right now, like with Gilbane, the construction company that just finished our renovations, even during the summer, what can we do? So they had a boatload full of donations that they just gave, and so people often will come to Emma with donations, and so our kids are not lacking for the basic skills and donations: crayons, pencils, paper. We have a partner that I had at a previous school. Her and her sister, retired teachers from up north. They come every week. They take a wish list from our teachers. What do you need? If the art teacher needs this, she gets it the next week, and she's there every week. She's in my school, she's in Booker Middle, and we're very appreciative of those individual partners. But there is nothing like with the basic school needs that we're lacking that we cannot get for our kids. Really, we're working on those, getting those incentives, putting those things in place to motivate the students as well as support our families to making sure that they're getting there, attending our family engagement meetings and curriculum nights that we have to help them partner up to know what they need to do at home to support the learning at home.
The one meeting that I went to at your school.
Yes, ma'am.
You were inundated with parents.
Yes.
There wasn't enough room in the cafeteria to be able to even sit down. Like, they were lined against the wall. So I would say you have parent support.
It's a great problem to have, isn't it?
Yes.
Really is.
And the rest of our presentation really deal with the tier and the support that we have. But at the end, it's about Emma being the village and having the support of everyone. I feel the support from our district, our superintendent, as he stated before. He started our meeting, our first meeting, our 7:30 meeting, after our grade was reported, and says, we own this. We're in it together. We're in it with you. You're not alone. And I thank him for that support, Dr. King, as well as Mr. Renoff. It's been very supportive from the district level, from the state. And it is a team that's about school improvement. And so this D is just a time for us to reflect on the framework, to really tune in to what we need to do to consistently keep Emma moving in the right direction. And I thank them for that support. So I want to thank Mrs. Zucker and Mr. Robinson for always being available and coming out to Emma, not during the cold drills or whatever. She won't get stuck in the kindergarten room anymore. So come out anytime. I invite you, Ms. Goodwin, in the absence of Ms. Brown and Ms. Ziegler, to please come out, see Emma in action. Pick a day.
I will
just show up and just come on out and see us and see the great things that we have in place, and to see our students and our staff, and even run into a few family members, because it is a village in Emma. And I am a very proud principal, and I believe we have what we need right now, and consistently will keep that next year to keep moving in the right direction.
I'd like to say something before you leave.
Yes, ma'am.
We did a lot of celebrating on achieving our A. But we didn't take the time, I feel, to celebrate the individual achievements at all of the schools, because all of the schools had other points that should have been celebrated. And I think while our back-to-school presentation was great and was focused on the A and the awesome, there was some people that felt like, okay, but I did great in my school, and I might be a B or a C.
I heard that.
But look where I've come from. Look what I've achieved. And I think that we have to make sure that we take the time to celebrate those successes as well as the fact that we're an A district.
Great point. And just before we close, I didn't see them enter, but we talked about it as a village. That is the representation from our elementary curriculum team, and they are all eager and out there to help. And so in any way, shape, or form, I mean, there is wraparound at Emma Booker. So thank you for your support.
Thank you.
Thank you.
We're here to help.
All right, next up, we have the Circus Magnet Program at Sarasota High School and a presentation by Steve Canties, David Jones, and Michelle Anderson.
Dun, 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 dun,
Good morning.
Good morning,
This is
everyone.
Exciting.
I think I could. So, good morning. I have Michelle Anderson. She's an assistant principal here at Sarasota.
Good morning. Morning.
And everybody knows David Jones, a principal at Sarasota High School. So today, I'm excited about this. This is going to be a wonderful opportunity for our students. Sarasota High School has a lot to celebrate these days, and one could call it the greatest show on earth. It's a pause. Okay. So due to the quality work of the staff, families, and students, Sarasota High last school year moved from a B to an A high school. Cheers. Yeah. And Sarasota High School continues to be recognized as one of the top ACE programs, if not the top ACE program in the state of Florida. And they have that renowned math program in the science and math area and technology that does incredible work. Yesterday evening, the Sarasota City Commission should be applauded for their work for vacating School Avenue to the school district, ensuring our students and staff are as safe as all other schools in the district. And of course, our district believes in providing options for our students and building collaborations with our many wonderful community partners. Today, we will preview for you a potential new program that brings together two great traditions in Sarasota. Our flagship high school opened in 1913, and the Sarasota Circus, founded in 1949. You'll have an opportunity this afternoon to vote on an agenda item that will formalize this partnership between the Circus Conservatory and Sarasota High School and the school district. So to present the Sarasota Circus Arts Program to you today, a very unique program. I can't imagine there's too many of them out there. We have Sarasota High School Assistant Principal Michelle Anderson, as I said, and their very own ringmaster, David Jones, the principal.
Well, thank you. Good morning, everyone, and thank you for this opportunity to speak with you. Is this projecting? You can hear it okay? Yeah. I'd be remiss if I can just address the School Avenue thing for 1 minute, if you'll indulge me, because 3 years ago I made a wackadoodle decision to invite community members into my office to just get a pulse of the community about what it would take to close School Avenue. And I believe Jane and Shirley were there and saw that basically got beaten to death and was told that over their dead bodies it would ever close. And I just want to thank the board for the resource commitment and seeing this thing through. And last night, I can't tell you how many meetings I've had to speak at on this, but last night was the first night I actually did not have to speak. And I want to give a big shout out, because you should be so proud of these people. Arthur Hardy and Jody Dumas, they were the two that spoke last night. They drove this thing home, sealed the deal. There's been incredible people in support along the way, but I cannot thank you enough for the resources, the personnel, Chief Enos, the superintendent, all the people who have been coming to this. It's been challenging, to say the least, stressful, undoubtedly, and it's done now, so thank you. That's huge.
Well, I've seen, I think, all the commission meetings, the city commission meetings, because it's a far stretch for me to come from Venice, but I usually participate. But you all have done well. But I thought Dr. Bowden's daughter did a particularly great job one night. And I do think that Jody needs to be thanked because he's had not only facilities to run this summer. Are you okay? Yeah. But he has done a remarkable job as our acting COO, and you know, thank you so much, because we know what you're doing and how difficult some of it is. But I think this is, the cherry on top, shall we say. But David, I have never seen so many accolades for Sarasota High since you have become the leader. And people, parents, community members alike. It's such a wonderful school, and you've really made your mark. And thank you.
Well, thank you. I wish I could take the credit. At church on Sunday, I heard a sermon from a phenomenal pastor, and he said, in reality, I'm one step short of dumb. And I thought, that's me. So thank you. But it was truly the team, and I appreciate that greatly. Speaking of which,
This was 20 years in the making.
The School Avenue? Yes.
20 years.
Yeah, but I was kind of the ignorant pit bull that wanted to see it through. So, but it couldn't have happened without the resources and support of this board. One of the things I was able to claim repeatedly is that in spite of any division of votes that ever occur in this school board, this was one that all 5 members stood behind along with the superintendent, that this was about the safety and security of our kids. And I think that was a pretty powerful message. It transcended over, if you saw last night's meeting, the city staff conjoined with our attorney and our team that was up there. They were the unified ones. I mean, it was completely in sync, arguing that this was the right decision. So.
I like pickles.
Well, anyhow, in 2005, I came on as a math teacher at Sarasota High School, and immediately learned from some of my students that they participated in whatever that thing was that was in our parking lot where they did circus stuff. And so I went to my first performance that first December, saw a bunch more of my students who were participating in the band there, and I saw acts that were mind-blowing to me. And over the course of the 5 years that I was at Sarasota High School, after a year and a half moving to an assistant principal role, by 2010, that's when Nick Willenda walked across the Ritz-Carlton, and that was all sponsored by this circus program. And I thought, man, this is the coolest thing. I cannot believe a program like this emerged out of a high school. Well, then I left for McIntosh and Northport High School and came back to Sarasota High School in 2016, excited about the circus program, only to learn that the relationship had dissolved. There was no longer kids participating in the band there and whatnot. And so I suppose part of my blind ignorance is I called up the people at the circus and I said, what happened? And there really wasn't much explanation, but they came together, and within 15 minutes it felt like we were the best of friends. And that relationship evolved very, very quickly in terms of they started providing students at our pep rallies. They were our students, but they were heavily involved in the circus. They were at alumni events in particular, because the circus is so near and dear to the community, and particularly this endeavor known as Sailor Circus or the Circus Arts Conservatory. And so I had this crazy idea one day that after watching my kids that rehearse for the circus from 2:30 in the afternoon, often until 8:30 in the evening, and then they go and do their works. And these are some of the most talented athletes, and I will call them athletes, the things they do. It's just incredible. Wouldn't it be cool if we could have something that's like, this is a visual performing art type endeavor? Wouldn't it be cool if we could have a magnet program, given the heritage of Sarasota and the community, that these kids could actually come together, do some of their training, much like a VPA model, 2 periods during the day with expert instructors. And at the point I said it out loud, I thought, wouldn't it be great to get people like from Cirque du Soleil and some of the top talent in the world to work with our kids? Well, I decided, and I believe every one of you board members was at the Ringling event that was about a week later, and I pulled each of you aside and I said, hey, let me tell you my next wackadoodle idea. I want to do something like this, and I believe over the course of a year and a half, I met with each of you, and we talked about it more in depth. And so needless to say, a lot of things have emerged, and I have to give credit where credit is due, because it's one thing to have the idea, the vision, get excited about something like that. It's another to have the people who really have the finesse to put it together, because there's a lot of practicality issues that you have to work out here. Well, what about risk? What about the curriculum? How do you justify kids bringing in SEALs who put beach balls to one another's noses? Well, that isn't really what happens, but there's all these things, because we are accountable to the state with course codes, curricula, and whatnot, and how do we put it together? And so I want to give a huge shout out to Michelle Anderson. I'm going to turn it over. Michelle had an instrumental role in establishing the Law Academy at Booker High School. And so I knew that she had the finesse and ability. As Todd can tell you, I've been trying to get Michelle back. When I had her as an AP at Northport, it was my goal to get her as an AP at Sarasota High, which we achieved last year. And so, hey, Michelle, guess what? You're going to establish a new magnet program. And so Michelle will get into the nitty-gritty, and I think among the three of us will be able to answer the questions that invariably you would have, so that you can feel good about approving this endeavor as we move forward.
Well, thank you so much. Good morning. You all should have a packet in front of you, which is the result of the collaboration that I have been engaged in along with David and Jennifer Mitchell at the Circus Arts Conservatory. And so we have gone through and step by step thought about what is the best way to organize a program, put courses together, inform parents of what the program entails, try to anticipate, mitigate, and deal with, the fun that can come with the circus, but also some of the risks that comes with being involved in circus acts. And so we have a letter of support from the president of the Circus Arts Conservatory, and then we have in here a timeline of the Sailor Circus, because I'm a former history teacher, so to me, context and perspective and timelines are important. So as Mr. Jones said, in 1949, the Sailor Circus grew out of courses offered on the Sarasota High School campus, and so we want to bring that back. So we're kind of 70 years in the making. There was a time where it separated, but now we're going to come back in partnership with the Circus Arts Conservatory. You will see there is a course progression document that outlines the sequence of courses, and we recognize that we have current students who participate in the Sailor Circus who would want to be a part of our circus arts program, but also we might have students who don't have any circus foundation who'd be very interested in it, and we can offer that to them. So we have created some course progressions for introductory level students to enter in with just the passion and the willingness and the wanting to be trained, and then we have course progressions for students who have past experience and have some skill sets and training that we can put them into the intermediate or advanced kind of coursework. It is a 4-year progression, offering them electives throughout their entire high school career. They are primarily founded in the physical education courses, and the instructor would be a PE certified teacher who would use the PE standards to align with circus-oriented topics and acts and activities. Many of the general physical education requirements of health and wellness and flexibility, they all align with all PE courses, but can also be demonstrated inside of the circus courses with the circus framework as well. And in order to extend our students' opportunities, we wanted to culminate the program their junior and senior year with an AP seminar and AP research, which is part of the AP capstone program that we currently have our math students participating in as a culminating research event to give them college credits. So we want to give them this opportunity to pursue their passion for the circus, but also gain valuable skills that they can take forward into the university system should they continue all the way through the program. After the progression, there is an example We find it to be extremely important to let the parents know what their students would be participating in, and so we'll have mandatory orientations that all families would have to participate in before their students able to be enrolled in the program. For our current circus arts families, this would be something they're familiar with, but for the students who'd be new to the program, who are just, being exposed to it, this is an opportunity for them to see what their children would be participating in, and so they would have an awareness of what their child's day would look like. We would offer two to accommodate different scheduling issues. There's an application process that we would have students complete, where they would get recommendations from current teachers, and we would want to maintain a code of ethics and a high level of participation and behaviors for our program, because we do recognize that this would be a privilege for them to participate in, and we're affording them this unique opportunity, and with those privileges come responsibilities, and so there's a code of ethics that they would also have to adhere to. And if I'm going too fast, let me know.
What is your estimate of first year number of students that will be involved?
So our pilot program, we're anticipating about 20 students being involved, and we would like to grow that to a total of 50 students because they are blocked into two periods, about 20 to 25 each, and because of the requirement for supervision and the extra level of safety monitoring that we would want to have involved, we wouldn't want to expand the number of students per block greater than that without additional staffing. And right now we have a single unit staffed for the position, with adjuncts coming to us through the Circus Arts Conservatory. Some of them are members of the FSU High Flying Circus, some of them from Cirque du Soleil, some of them are current practicing circus arts performers here in the city, and we'll grow that program that way.
How many circus programs are there in the state? I know a little bit about this because of my friend sitting over to my left, but how many circus programs in colleges are there in the state?
So the only one that I'm aware of is at FSU. So I think that was a great connection. And
the world's finest collegiate circus.
I was not going to get into that.
Correct.
Football team.
The football team, right?
Yeah, maybe that's an alternative to football.
When you were talking about the teaching staff, in the contract it says the school board shall have the responsibility to provide an appropriately certified teacher to teach and supervise students. What kind of a teacher are we talking about?
It would be a PE certified teacher. It met the same requirements for other instructors in academic courses.
Okay.
With a strong circus arts background. As a matter of fact, all of that hiring, we're working very closely with the circus to identify the correct individual. Once we get this thing codified, we will, there's several people from which we can choose.
My bottom line question really is, will we be paying for one of the trainers that are currently at Sailor Circus?
What we will do is, we already have built into our staffing for this year, should this move forward, the ability to fund an additional PE teacher. Actually, it's a 0.6 position is all that we're putting it at, because that fulfills the number of hours that we have. And so our intention on the Sarasota High staff is to continue paying that person that 0.6.
Okay, so it doesn't matter who it is or we're there, but they're our staff.
Correct.
Okay.
So the additional specialists that you referenced from the Circus Arts Conservatory and from Florida State Circus, they are in kind, or we're compensating them for that time?
That's from the 0.4 remaining of that position.
So I think that's the question that was asked. And so we are compensating the Circus Arts Conservatory for providing some expertise, but that's above and beyond the certified teacher of record.
I think that's an accurate way to put it, not to exceed at this point our 1.0 FTE.
That's what I was, thank you.
Just want to make sure you got the answer you're looking for.
Yeah.
Bridget?
Well, I think this is so cool. I think it's so cool, and I applaud you guys for your work, and I think you're right. This is something that's deeply rooted in Sarasota's culture. I think, and even when we were talking about enrollment numbers, I would suspect it'll grow pretty quickly. Naturally, I'm going to ask questions about risk. So, when I go through here, and I know that we briefly talked about it, and I know Art Hardy and I have spoken about it. So, the way I read it is they will be doing these at the CAC's location.
Yes, at the arena.
And so they're indemnifying. So the school board is indemnified. They're assuming all of the liability risk, and they're covering. I mean, so talk to me about what that looks like. Who's responsible for
our students? Our responsibility. Yes. And so the distinction is the same student can be in the same location at 2 different times of day. And at one point in time, they would be our responsibility if it's during the school day. If it's after school, it's the responsibility of the Circus Arts Conservatory.
Okay.
And so that was really the major hang up in regards to working with
where the liability falls.
Correct. So our student on our time is our
liability.
Yes, ma'am.
And but they're also on their facility.
Correct.
So within the agreement, it talks about they are required to keep. I mean, there's a whole 6 and 7 were the ones I had highlighted, as it speaks to, because Sarasota County Schools is not now taking on the assumptive capital cost of that particular site. Is that accurate? Or are we?
Well, yeah, the only cost that we're taking on is a portion of the utilities, and that exact amount for this school year, because it's unmetered at this point. So it's a best guess is that $10,500 of that is coming from us, and again, that's already within our budget.
And that's just facility maintenance.
It's air conditioning.
Air conditioning. Okay.
Broken into 10 payments.
Yeah.
Okay.
That's
fair.
But understand that those particular hours that occurred during the school day in which we own the liability, prior to 2:30 in the afternoon, it puts a good and reasonable number of limits on us. In other words, the students are not going to be doing trapeze during that time. They're not going to be doing high wire acts and things like that during that time.
Okay.
That was
answered my question.
I mean,
you hit it right out of the butt. I mean, I think that again, and then I guess the other part is as this grows and has to be reviewed, the capital costs in the future of that sharing. Just being aware what we potentially could expose ourselves to, but we'll have to make that decision at that given time. So I believe the contract is it
one of the reasons that we got rid of the circus was the fact that it was insurance was too high.
So going back to my question is that set in stone on the actual capital cost sharing? What the requirements are?
It is.
Language?
It is. Okay. And so actually that cost on a per student basis will come down as the academy grows. And so you can't air condition a portion of a big top. And so our hope is as it grows, it becomes much more cost effective as a program.
Perfect. I think this is awesome. I'm super excited about it. You have my support all day long.
I also am in support of this. I think it's a great program. When I spoke to you, I thought you were like 5 years out, so I was rather surprised that you put this together so quickly, David Jones, but not really surprised. But I think it's a great program. There's so many wonderful choices that we have in our school district that we don't really need a lot of other outside choices, I think, but then that's my own opinion. Public schools, I think, are really the most important, one of the most important options in our community. So thank you for your involvement with the Law Academy, because boy, is that a great program.
It's an amazing program.
And a different program from a lot of other programs. And I think we need to be heralding that a bit more as well. But this is certainly another thing that we can add in our toolbox as being one of the exceptional things that Sarasota County does. So I am fully in support.
So can we walk just real quickly through the implementation timeline? It's your goal to have these courses up and running this year, which means you're going to recruit students from your existing student body.
Correct.
But as we look forward to the 2020-21 school year, it would be a true magnet at which students would be recruited and have the ability to come there specific to a circus curriculum. Correct?
That is
correct. We have a number of students already. Best guess, these are kids that are already activated or actively participating in the circus. So those are the 20 or so students that Michelle identified are sitting in a PE class together right now. So we're waiting for board approval before we do anything special with them.
But in future years, you're going to actively recruit. I mean, it's
Yes.
a true magnet, and,
Yes.
and students from outside of Sarasota's.
You'll hear all about it in January and February.
There you go.
I saw Pedro last night at the supermarket, and he came over and gave me a kiss, and he said, "When are we going to finish this? When is this going to be approved?"
Yeah.
It's coming, it's coming.
Circus performances at our middle schools in the spring.
There you go. I mean, it's just to me an extension of the partnership that's already in place between the Circus Arts Conservatory and the Sarasota schools with the elementary and middle school outreach, and then the camps. I was able to go over there in the summer and see the camps going on, and that's such a great opportunity for students, and this is another way to build that community connection with our history and our future.
And, I want to comment on that real briefly, because one of the things 2 years ago that was very apparent is the Circus Arts Conservatory has had a great commitment to education all along, and not just of acrobatics and things like that, but of science principles. They had a full-time outreach coordinator that we were meeting with 2 years ago before this wackadoodle idea emerged, in working with our engineering teachers on physics concepts and things like that, where we were actually bringing them over to the circus and getting to experience some of that. So it was just kind of a natural evolution.
And could I say real quick that I want to commend these two as well as the rest of their staff for the work they did on this. It was really, we kept going back the well and we kept asking questions, and the risk was kind of at the top of our agenda too, making sure we were good there. But each time they came back with the answers we needed so we could keep this moving forward. Took a little longer than we anticipated, I think, but ultimately we wanted to see it happen. I also want to say that at Sarasota High, you think about the connections we built with the circus now and the connections we're building with Ringling School of Art and Design, with the museum that's sitting out front, as well as their education facility that's sitting at the old Sarasota High School, not to mention the ACE program and the MASS program. They're continuing to build connections within the community that really Sarasota High School is on a real strong upward trajectory, and we can be real proud of the leadership there, but we can also be incredibly proud of all the staff at that school. They have that science program's amazing. The math program's coming along. I'm just very, very proud of the work that everybody's doing there, and we can all be proud of that. A lot of that has to do with you all supporting these types of programs and giving us the ability to think outside the box. And I don't know any other district that has an ACE or an IB program at every one of their comprehensive high schools. We do it, and I think we do it really well in every one of our schools. So, a lot of the credit goes to you guys, too. Thank you.
When we started it, it was supposed to be at each school was supposed to have a specific focus. But I was glad to see that every school has a component of all of it.
Yeah.
So that, plus their own speciality. Both of my grandsons are circus kids.
So
Really?
I knew them from Booker. Yeah.
I know you're surprised by that.
Yeah.
How about staffing? Are we fully staffed in
At the
terms
school?
of teachers? Yes.
Not quite yet, but part of that is we just had 2 units added to us, desperately
Right.
needed, and so a new position will be posting tomorrow, pending the results of any potential surplusing from other schools. But we're getting darn close. We've got interviews lined up this afternoon
Great.
at 3. We're almost there.
Great.
Well, I just want to say your tenacity, closing School Avenue was definitely one of them, but doing this and going back to not letting the risk, because I think Caroline said as before, is that's basically what had stopped it in the past, and there is always a way around it to work it out. But I appreciate you guys working through this, and I think you guys did it quite quickly. I mean, I remember when you mentioned it, and it was kind of just a off-the-hat idea, and here it is. So I'm excited. I love it. Maybe my daughter will be going in there. So
Wow. There you go.
Well, thank you very much, and
Thank
good
you.
luck.
Thank you.
Interested in seeing how this all progresses.
Right.
Be glad to see you.
Well, thank you so much for the support.
I love those pictures in the, did you see those pictures back in the day when the...
I love those
at that
pictures.
Sarasota High? That's amazing. That's the first
Yes,
time I saw
it is. Let's take a stretch break and a couple of minutes.
What does what say? do you one better.
We need to start pushing on that one too.
Well, I think we're ready to get back in session.
Okay.
Next up, we have our Oak Park update, and we have Steve Cantanes, our principal, Jamie Lowitz, and Sonia Figueroa Alberts, our illustrious Pupil Support Services Director. Now, you notice I said illustrious,
Yeah,
right?
thank you for that one.
She is illustrious. I would agree. So,
Your mic.
Mike.
Steve, not Mike. Okay, so this portion of the school board workshop is dedicated to discussing our center school for students with disabilities, Oak Park School. Superintendent Bowden and Dr. Kingsley have given me the opportunity again to work with Oak Park this year. I'll be partnering with Sonia. Sonia is the ESE statute law genius. We rely on her to help us get through those really difficult things. And so it's going to be, it's to me, I consider it to be a great opportunity. I have an incredible passion for the school. Most of you know, I have a daughter who attended there. And she finished at age 22. She's 27 now. And so, what you learn at Oak Park as a parent is that there are no options like Oak Park in this community. And the school provides intensive services. My daughter received occupational therapy, physical therapy, speech therapy. I mean, you can get that nowhere else. We have incredible services there. She also, they bring horses in once a week. We do hippotherapy. They have a full-service swimming pool for students with disabilities.
Named the Marge Baldwin Pool. I might mention that because
Thank you for mentioning that.
had someone who had mentioned this to me that we did not reflect on that name recently when we talked about updating.
Thank you for doing that. I appreciate that. So it's an amazing facility. And, due to the intensity of the special needs there, we ask so much of that staff. I mean, we really ask a lot of that staff. And, they rise to the occasion every day. I've been there. It's funny when I walk around campus, there's always, the first question is always, how's Stephanie? That's my daughter, from everybody there. They knew me as a parent. They also knew me as a school district administrator, built a lot of relationships over the years there. But I always admire the fact that they come there every day, bring their A game. And they're a family. Like all families, sometimes we butt heads, but at the end of the day, they're there every day for the children in that school. So my daughter learned incredible life lessons there. My wife and I did too. So obviously the school's not for everybody. You have options. We talk about options in this district. I remember when we enrolled Stephanie, Laurel Nokomis was our district at school, and they said, hey, we can take care of your daughter here, but we can also, you might want to visit Oak Park. And so, when we visited Oak Park, it was just an incredible experience. And every day was an adventure there for Stephanie, and it was amazing. So I know firsthand what the school's about. I have a great passion for that school. And so I appreciate you just kind of letting me go through that. I am very excited to be working back. You have a packet in your information today, and looking at the agenda, Jamie's going to start us off. Jamie Lowitz, everybody knows Jamie. She's the principal at Oak Park, and she's going to do a little welcome and talk about where they are right now. She's going to talk about what the teams look like. I think it's important that everybody understands what all the teams, there's 5 teams in that campus, and I think it's important that everybody understands what those teams are and what they entail and what the disabilities. I'm going to talk a little bit about the staffing plan. CPI training is going to be discussed by I think the team following us. I think we have another presentation. I'm sorry, guys. You have one more presentation after this. I think there 2 more after this. Okay. So we'll be doing CPI. That conversation will take place after this. Then we're going to talk about our PD plan.
Could we ask how many staff do we have that are permanent versus long-term subs in the teaching arena at Oak Park?
We do have that information.
Okay.
We do have that information. So currently, we have 10 instructional vacancies. Okay, everything else is filled. So those 10, and 2 of those are because are new because of the enrollment. We started out this year at the end of the 5-day count at 354 students. That's where we ended the year last year. At this time last year, we were at 299. We could anticipate anywhere from 30 to 40 students this year. That's a pretty common practice that will happen. So we have 10 vacancies in the instructional side, and then on the classified side, we have 36 vacancies. We have pretty much at the direction of the superintendent and working with HR, they have worked incredibly hard to provide bodies in the form of substitute personnel in all of those classrooms. We've even had conversation and we've implemented a practice that for the instructional aides, which are essentially 2 to 1 on that campus, instructional aides over the teachers. So we are for those instructional aides, we're paying them long-term sub-teacher pay when they come in and take those positions. Definitely one of the challenges we face in that school, first of all, is enrollment is continuing to increase. We have people come to that school from all over. And then the second challenge with that enrollment is finding the staff to support that. So we'll
Steve,
continue to work.
How many centers do we have around us that operate as Oak Park in other counties?
Around us, I'm not aware of any.
Okay, that was my question, because I know people.
Lake County, probably.
The Lake County one I'm going to visit next month because I'm going to be in Lake County for a meeting. And I know that Jamie has told me that they talk frequently.
Harbor.
Okay.
Yeah, they do have one.
Just pending off your question, and I may have missed it. So, is there a breakdown that we talked about, Todd, about like long-term subs by month?
That was provided to you in an email approximately 2 weeks ago.
Okay.
Yeah, it's not part of this package. Okay, so that's the situation with the hiring and the vacancies. We're continuing to work on that, and if you don't have any other questions about that, I'm going to go ahead and move this over to Jamie.
Before I start, may I add that we have been working with Danielle Schweid in HR with a new talent acquisition specialist, and that person has been very instrumental in providing us with names of people that maybe aren't as familiar with what our needs are at the school and forwarding resumes to us. And because Danielle has partnered us with that new department, we have been able to hire 3 additional classified staff over the last several weeks. So we are very appreciative of the fact that HR is working with us and is passing that information along. So I just wanted to mention that because that's something that's
she's great.
That's been new. So I want to thank you for allowing Steve and Sonia and I the opportunity to be with you today to have a conversation about Oak Park. We have started the school year. We're off to a fantastic start. We welcome the faculty back on August the 5th. And we made sure that we did something very special every day to make sure that they felt appreciated and supported and wanted on that campus. And before we begin and we get into the nitty-gritty of the things that we really need to address our tougher conversations, I wanted to provide each one of you with a gift that we did give to our faculty during that week. This was on, I believe, day 4 or day 5. And I want to offer this to you because I know that, like, our executive directors, our district support in the back, and our administration, you too recognize that our staff at Oak Park work tirelessly to support the success of each and every one of our students. And so I hope that you'll accept these and wear these proudly as we go out and share the positive message about Oak Park School. So if you would pass those around, I'd appreciate it.
Just get one there.
Thank you.
I'm going to keep one for Mrs. Brown.
You're welcome. Thank you. So I believe the next page after the cover sheet in your packet is a description of the Oak Park teams. And I'd like to just run through this with you so that you have a better understanding about how our school is laid out. So if you'll follow along, we have the action team, and underneath that, I have listed out how many teachers are in each of the grade levels, how many paraprofessionals support those teachers in those grade levels, and how many students are currently enrolled in those grade levels. So with our action kids, we have elementary and middle school. These are kids, if you look underneath them, you will see the exceptionalities that are pretty standard with students that have these disabilities, and I have listed them out, and I've also given you the acronyms, because a lot of times when we talk about EBD, or we talk about OHI, or we talk about SLD, people who don't have an ELC background get lost in the lingo. So I've provided that just as a reference for you so that when we talk about these populations, you have a better understanding of who it is that we're communicating about. Our action kids, we serve elementary through middle school, and as you may or may not know, their 8th grade year is a big transition year for them, because if they have been with us throughout their schooling at Oak Park, they then must transition to one of our district cluster sites, either to be served at Northport High School or at Riverview High School in the EBD clusters over there. These are students who are assessed under the FSA, the Florida Standards Assessment, and they access gen ed curriculum on a daily basis. And so I hope that kind of clarifies that team. They are different than the other 3/4 of our population, and I will start to talk about those teams now. So first of all, we have our...
Caroline.
Yes, ma'am.
I'd like to point out that the reason that they are now transferred to our high schools is because the state put extra pressure on us that they were supposed to be passing the FSA and all of those other tests, which there's no way that those kids could. So they were put into our regular high schools. They were transferred into our regular high schools. I remember when Laurie White did this.
Well, we transitioned also because years ago when they changed general diploma option, a lot of these students are FSA, and they have to access a lot of different courses, and teacher certification became a problem as we were not able to offer a lot of the options in sciences and math and ELA at the high school towards regular diploma options. So we have transitioned them to the high schools, and some of them go to their neighborhood high schools. Not all of them transition to a cluster.
Right.
I would like to add with our FSA population, because they do sit beginning in 3rd grade for the FSA. And this year, I am very proud of the hard work that our faculty did in supporting those students, because we had the lowest number of retentions in 3rd grade that we have ever had in the history of Oak Park. We sent kids onto the 4th grade, which is just... It's phenomenal, and it's going to be life-changing for these kids to be able to go on and not have to be held back. And then we were also able, through Sonia's guidance, we were able to put in a reading program this summer in conjunction with our ESY programming, and so we had a reading camp that was designated specifically for our Oak Park 3rd graders so that they would have the opportunity to take the SAT 10 at the end of summer school, and we did have students that passed that as well. So we had a very small number of students needing to be retained in the 3rd grade this year. Okay, so we'll move into our FSAA side of the house. Assessment-wise, that is the Florida Standards Alternate Assessment, and those are broken down into 3 teams. We have the DAT team, that is our Developmental Assistive Technology team, and we service students from pre-K all the way through high school. Their exceptionalities include, but are limited to, them being medically fragile, language impaired, speech impaired, ASD, autism spectrum disorder, intellectually disabled, orthopedically impaired. So those are our most, again, medically fragile students that we have on our campus. We have our spectrum students who their primary exceptionality is ASD, or autism spectrum disorder. We also serve kids K through 12th grade in our ASD program. And then we have our transition portion of our side of the house, that is elementary through high school as well. And exceptionalities on that team include students primarily who are intellectually disabled. When you move and when you think about Oak Park, it's important to remember that we are 4 schools within one center. And I like to bring that up just so people can kind of visualize what that looks like on our campus. So we're one campus, but we have an elementary school that is functioning there. We have a middle school that is functioning there. We have a high school that is functioning there. And we also have a post-grad program for our students who you will see in this yellow. Those are our structured employment students who are working on employability skills and have that opportunity to do so up until the age of 22, so that we may help find employment for them. We can look at hooking them up with outside agencies so that there is a plan for these students once they transition from Oak Park School out into the regular community. All of those teams, the DAT, the Spectrum, and the transition teams, all are on the Florida Standards Alternate Assessment track. So we test on both sides of the house at Oak Park School. Were there any questions about the teams?
No.
Okay.
I just want to thank you because this is the first time I've seen it laid out like this where I can totally understand what it is. So thank you.
Sure. Mm-hmm. I think, are we moving to
So again,
staffing?
I've gone through the
Okay.
staffing piece already. You know, Jane asked that question, and that's an area we're working with, trying to get innovative and creative with our approach. We're going to have some additional conversations and meetings around that. I do think one of the keys to the success of Oak Park is putting a highly qualified teacher in every one of those classrooms with the instructional aid support there also. You know, I always tell my principals, you know, your money's earned every day in the classroom. It's that teacher, the support in that classroom that's going to make us successful every day in the classroom, and so that's where we have to get to. Now, the challenge with that is we're looking for ESE teachers from here to California. Everybody's looking for the same group of teachers. Everybody's looking for math teachers. Oh, I'm sorry. I don't have to start over, do I? So anyway, I apologize for that. So everybody's looking for the same group of teachers from coast to coast, and it is the ESE teachers in the state of Florida. You have to have a content area if you're an ESE teacher, which even makes it a little more challenging. So we're looking for math, science teachers, you know, at the high school level and middle school levels, and even ELA teachers. So the challenge is to look at one of our most needy areas for teachers, and in a center school, I think that's exasperated a little bit. So we're going to continue to work on that. We're going to use our hiring support that we've recently added to the HR department, and we're going to tackle that. We're going to make some hay on that. We're going to make some progress on that, I'm confident.
So before Jamie comes in terms of what we have done in the integration of culture and climate, we have to understand that for especially design instruction, we need to integrate positive behavior support in terms of the culture and the climate of the school, to celebrate our teachers that every day come to teach our most significant students, and also our paraprofessionals that assist in the implementation of specialized design instruction. We also need to keep in mind that Oak Park receives students all throughout the year, weekly, at times monthly, at times I'm calling Jamie, because these are the most significant challenging students that enter our regular schools, but for one reason or the other present challenges that we need to provide the most significant supports at Oak Park. And we're able to do that because we have a separated school, but with that becomes challenges. So this past year, we were really understanding how we can integrate all the initiatives that we have provided in our school district regarding social emotional learning. If we provide a calm environment, we then can provide that direction that our students come to us from trauma, and they need that hope, they need that support. And our teachers are so, in a way, very structured, but in a way, very flexible to receive our children that come to us with the most significant challenges from our regular school. So Jamie worked very close together with the whole team. And how do we build that integration structure under the umbrella positive support interventions for the school? You want to jump in, Roar?
Right. And before we go into Roar, if I can go back to staffing for just a minute, because what Sonia says is really critical to our mission. We have looked through our staffing allocations over the last couple of years to see where we can get the most bang for our buck so that we can be supporting students in their social emotional learning, because it's very akin to Maslow's hierarchy of needs. You have to meet students where they're at, and you have to provide for their basic needs before you can start to expect them to perform in a classroom. And so how can we accomplish this? And one of the ways that we are accomplishing it this year, and we're very excited about, is that we were able to take a teacher allocation or 2 teacher allocations and convert those positions into support positions. And I think that that's really important to mention so that you understand. We are really attempting to support kids within the classroom structure instead of having them to have to be removed and pulled out from their academic environment. We want students to be able to learn how to be good, productive citizens within their classroom community so that they can engage and access their education. And we've done that by hiring 3 registered behavior techs this year, and that is completely new to Oak Park. We're really excited about that, and they will be supervised by our BCBAs, our board certified behavior analysts, and they will each be given caseloads of students who we know struggle to remain in the classroom. And they will be providing supports within the classrooms to the teachers and also to the paraprofessionals in conjunction with the student's behavior intervention plan. They will look at what needs to happen. They will start to give teachers training on the strategies that need to be implemented so that we can be proactive and de-escalate situations before they become so involved that they have to be removed from the classroom, or we have to remove other students from the classroom. In addition to those 3 people, Sonia has created an opportunity for us to add a licensed mental health counselor to our Oak Park School full-time, and she is working with a caseload of 20 students at the elementary level. And I know that she has been in contact with First Step to see if we can get the same type of support for our secondary students. So we really started to tackle this based on the support that our kids need, because again, you can't start to attend to academics until you start to meet those social emotional needs. And many of our kids have come from very traumatic backgrounds. Many of our kids live in poverty. Many of our kids have had significant adverse childhood experiences that present great barriers to them for accessing their education. And the hope is that through placing these additional support personnel on our campus, we will be able to start to more adequately meet the needs of our kids. And I don't want to get too far into this unless you have further questions, but we have kids who have medication issues, whose parents are unable to afford medication for their students, and so oftentimes they'll come and they won't have the necessary medication. We have kids that don't have the health equipment that they need to come and access their education. There are many obstacles that this population faces, and they have challenges anyway, just natural challenges to accessing their education in the classroom. And we really are strategically trying to do a much better job in providing what is needed for these students so that they can come every day and feel safe, they can feel nurtured, they can feel welcome. Many of our kids leave from a school not on good terms, right? So if you're attending a school and you have engaged in conduct that is inappropriate or is unsafe or is causing disruption to another campus, and you are an ESE student, one of the placements always is to look to see if the student can be better supported at Oak Park School. And so imagine a child who has been taken from an environment that they are very accustomed to being in. That's where their peer group is, those who they hang out with in the neighborhood, and they are transitioned to a new school that sometimes is not what they want to have happen. And so we deal with that on a very regular basis, and we spend so much time making sure that students and their families are well prepared for the transition from those schools into our school and are welcomed and know that this is going to be a safe place, and we are going to work with their students and with their families on strategies to support and hopefully help, if the chances permit, to reintegrate those students back into their districted schools. So I'm sorry, I know I kind of got off track there a little bit, but I think that there's a bigger picture that has to be understood about where some of these kids are coming from. When they get to us.
And I experienced with a child that's just come to Oak Park one of those issues just this past year. So, you know, it's you have a big challenge and a big job to do in terms of the 13 different issues that we have with exceptionalism and the fact that we must meet all of them. Other schools, other private schools do not, and many charters do not. So, you know, we really are doing a great job.
Thank you. So,
quick question.
Yes, sure.
And it's actually, I had it written down, but what you said, and to me is, I believe that Oak Park can pose some of the most exhausting and challenging circumstances for educators. And so one question I have, and I know you hear about educational burnout across the entire, no matter what school you're teaching at, but I know we struggle to try to find proper services and counselors school by school, but have we thought about providing counseling, supportive services to our staff so that they stay, because I can only imagine all of the myriad of things that they are dealing with at any given time, because it is so diverse. And you can put and I love this table, but even within that, you know that there's multiple different scenarios in each one of these cases. So, but when we think about how are we going to really continue to keep Oak Park as a phenomenal school and an amazing asset, but it's all, and have staff, when you already said this is a challenging area to fill for anyways. I mean, do you find that there's an emotional drain on the individuals who are working in that space? And is there anything we can do a better job to help support them, to retain them? Because on the financial standpoint, it's cost beneficial to invest in that area.
So that's twofold. If I may, I'd like to let you know that we have been working with risk management for the past year and a half with Lynn Peterson and her group. And this year we are proud to offer monthly I'll call them mental health activities for our staff to participate in. We kicked off our pre-week with a session that Aaron Singerman helped us put together, and that was really just introducing our staff to EAP and all of the things that come with the umbrella of services. So many of them sat through that presentation, and it was a 40-minute presentation. Many of them were just amazed at the offerings and the support that could be given through EAP, and they are very clear now about what their benefits are through that program, through our insurance. So that was our kickoff. They plan to offer yoga. They plan to offer stress management. They plan, I think there was one for acupuncture. There is a myriad of activities that have been scheduled, and it's monthly, where we are working with risk management for them to be out on our campus and actively supporting our staff and kind of just helping us to learn how to take things as they come, but also taking care of ourselves, because we know and we're very cognizant of the fact that we are not going to be able to take care of our children if we are not taking care of ourselves.
Okay.
So
we also, just along those lines, I apologize, we've, working with the district out of Dr. Kingsley's cost center, do you all know Mark Robinson?
No, I don't know.
You say it wrong.
Mark is...
Cousin Mark?
So he is he's a former teacher in our district. He went on to, he's worked for some companies talking and working in this exact area you're talking about. I think it's incredibly important that we do support those teachers. You're exactly right. And so he is going to be putting together, working with the staff, working with the administrative team and instructional staff, putting together a plan where we're going to provide professional development along those lines. But it's not about training for instructional strategies. It's about training for social and emotional well-being, because we recognize that same thing. So I think you're going to see a well-rounded approach to that area, and we should see some benefits in that area.
Thank you.
When will these classes, events be offered? What time during the day? During the planning period, after school? Because
there are
so
different
many
times
emails.
to make it accessible to everyone, and it is voluntary. Nobody is being forced to participate. It is voluntary, but we were really encouraged by the wonderful feedback that they received from the first session when they introduced EAP. So we think that many of our faculty will be taking advantage. And Bridget, you mentioned one other thing that I just wanted to touch on really quickly, and it's about staff recruitment and retention, I think, if I'm understanding your question correctly. And for the past 2 years, we have put as one of our overarching goals in our SIP plan, how we want to go about over the next 3 to 5 years to plan for staff recruitment and retention. And one of the things I think that we can all be very proud of is that it's finally in negotiations this year to talk about recognizing the work that our classified staff do on a daily basis, and hopefully increasing their designation from SSP 4s to SSP 7s. So that is something that I know that our staff is very excited about, that it is finally out there on the table and it's being talked about and it's being addressed. And so I thank the superintendent and you all for making sure that that is at least going to be part of the conversation.
Because we were losing paraprofessionals at a higher rate than we were losing teachers, correct?
Yes, ma'am. We typically, our paras don't leave our school because they're unhappy at our school. They love Oak Park and they are deeply committed to the students at Oak Park. What we have found is that when Title I schools have openings for their paraprofessionals, they are at a higher pay grade. They're an SSP 7 because they're a Title I school, and we are SSP 4s. And so, like most of us, when it comes down to providing for yourself and providing for your family, you're going to look for opportunities to go and better support your circumstances. So it's not anything that it's unfortunate, because there are people that would stay, and I truly believe that if we are able to get this accomplished, that we will have paras return, because that is truly what their passion is, to work with the students and the teachers at Oak Park.
That's why it's so important for us to be able to negotiate so that we can accomplish some of the things that we've put out there.
I'm going to take this moment to kind of jump in, because we've talked about the classified staff and we've talked about the instructional staff. I want to talk about the administrative staff for a second. I had the opportunity during pre-planning, as opposed to holding a meeting, I just said I'm going to be available. 25 members of your staff came through. There was a question that was asked, and I had a chance to tell the story about how Jamie was selected to be the principal at Oak Park a little over 2 years ago, but we've not really said that publicly. Jamie did not apply to be the principal at Oak Park. when we moved Edwina to Emma E. And there's a reason for that. We were implementing our new two-tiered system at the high school, and Jamie had been selected to serve as the APC at Sarasota High School. And literally 2 weeks after she was selected to serve as the APC, we posted the Oak Park job. And so she did not apply for that because she felt an obligation. She had just been promoted to an APC, had just been moved into that role, so she did not apply for that job. We went through our normal selection process, interviewed the applicants, and just quite honestly, nothing against those that did apply, we just didn't have the right fit. As we met as an administrative team and said, who's really the right person for that job, we were in complete agreement that Jamie was the right person for the job. So I had an opportunity to talk to Jamie, and my first question was, well, why didn't you apply for the job? And she did not apply, quite honestly, because she felt a debt to Sarasota High School. Her professionalism told her, you don't accept a promotion and 2 weeks later apply for another job. And so we placed Jamie there on an interim basis. She very willingly went, had told us had she not been promoted to the APC, she would have applied, and we were impressed with her after a year and made her permanent in that job. And so there is a false narrative circulating in our community that somehow Jamie does not want to be at Oak Park. Jamie did not apply to be at Oak Park, that somehow I have twisted Jamie's arm to be at Oak Park. But I just wanted you to know the backstory about how Jamie came to be the principal. And I have to tell you is that I'm very impressed with the work that she's doing there. She's in her third year. And so she's better this year than she was last year. And she was better last year than she was the year before. And she's growing as a leader. But I just want you to know that she's the right person, but to have the backstory about how she became the principal at Oak Park.
It is really too bad when rumors begin. It's almost impossible to stop them. So I'm glad that you're taking the time right now to address this issue because it's time.
And there is no arm twisting. No. No.
You could ask her when I'm not around if you want to.
You know, I was, I'm going to take some credit here. I was the one that hired Jamie from Charlotte County. She was in Charlotte County. She came to us from she has an English and reading and ESE background. It's on. English, reading, and ESE background. And she came to Sarasota County to run the EBD, our first, when we transitioned the EBD unit to Riverview High School and Northport High School. She ran the run at Riverview High School and absolutely did an amazing job. And then she moved on to being her first assistant principal job at Sarasota High, moved on to be an APC. She has great credentials, great background, and she's definitely the right person for that position.
I'm going to add to that. Because that
You're gonna take
first
credit?
year, yeah, I am.
Not enough credit to go around.
However, we transition, talking about students that had been at Oak Park since, elementary. That was our first year that we planned at Riverview. We trained, we met with the faculty, and it was a lot of challenges, but she took our vision and implemented our vision. And out of 35 students, we graduated 33. And 2 other students opt for different choices. So it was, a team effort with great leadership, Mr. Cantis, and the team at Riverview High School. But it has been, in the challenges area of special education, it's about really having the right people to take the journey and respond to challenges, because our children come to us from different and diverse backgrounds, and they have different and diverse needs, and we have to really tackle and really protect our teachers and our staff so they can continue providing that love for our most significant challenges students.
So the rest of the packet, you're going to see the professional development plan in there. You're going to see the timeline for that. You're going to see the ROAR plan is that combination that Sonia was talking about, our PBIS with our MTSS processes, and the specific programs at Oak Park, which are very much needed to support the student population there, as well as support the teachers in their work every day.
Can you define your acronyms, Steve?
Do what?
PBIS.
Yeah, just for the record.
Positive behavior support. Positive behavior support. Sorry about that.
Can I ask?
multi-tiers.
I have a quick
students.
Bridget.
And I'm not, if we're going to cover this, forgive me, but, because I just want to make sure. We talked about the group, like how the quote unquote categorizations of the varieties, but is in the way in which they're grouped at the school, is that going to be, are you guys going to talk through that? I mean, or has that also changed? Was it grouped in one way and then we've changed it? Or, so that's not true, okay.
I'm happy to go back to that. Thank you for bringing that up, because I know that that's been a question on a lot of people's minds lately. So the teams at Oak Park have not changed.
Okay.
They have been like this. I go back, I've talked to Edwina Oliver. They were like that when she and I changed guard. They were like that when Mr. DePillo was there, and I believe when Dan Parrott was there. And I don't know principals prior to Mr. Parrott, so
that's part
so
of
I
me.
believe that this has been in place for at least the last 15 years at Oak Park. The teaming and
The teams, okay.
I refer to them as silos.
Okay.
They're on different wings. So if you're on our campus, each one of these groups of students is in their own building, in their own separate wing.
So not overlapping.
They are not overlapping.
Okay.
Our campus is a horseshoe.
Right, no.
And if you walk around the horseshoe, when you start on the left-hand side, you have the DAT hallway, and then you transition down, and you have the transition hallway, and then you come across the back way, you have Spectrum, and then you go down toward the front, and that's our action hallway with our EBD kids. And then our structured kids who are working on employability skills and life skills, who are post-grad, 18 to 22, we have moved them out into our portables that are in the back of the campus because they are older. And so they have their own learning community out there in the back of campus within the portables. Those students are frequently off campus, working in employment situations, and so it just made sense to have them be out in their own area so that they can come and go without disrupting the K-12 flow of the day.
So one of the questions was about grade bands too. I think that.
Yeah, I mean, so there was so we have the teams, and then within the teams, how do you, because it's so different than
concern. Would you address that, please?
Yeah. How do we, so I'll finish that, whoever's watching, but within those teams, what's the decision-making process look like on how do you group those set of students? Because of like we talked about, the variety of teams within each silo, pillar, whatever you want to say, there's a grand diversity of those child's unique needs and from the safety component too.
Sure.
So can you talk about that a little bit?
Absolutely.
Unless that was going to be discussed somewhere else.
No, absolutely.
Okay.
So there's not a combination of team within those silos, but there is a combination of exceptionality. Okay. So we have an administrator that is over every school level. We have found that makes sense to have an expert at every school level so that we can keep up with the latest legislation, the latest changes to curriculum, the latest changes to how we go about discipline. If I'm sure that you know, elementary now has a new reporting form. Instead of going straight to a disciplinary referral, they have an intervention report that they use, and we don't use that in the secondary levels. And so we treat each of the school levels administratively where we are our own experts. So I have Nicole Mayo is our assistant principal who is overseeing our elementary, and that goes across team. So she's responsible for across team. And then we have Maureen Bassett, who is our administrator that oversees the middle school programming. And then I take over and do the high school and the extended transition kids. And so we're all working in our areas of expertise. We all have background at those school levels. And so the way that the kids are structured, I just broke it down by school level. So now when you break it down even further, so elementary, we try to keep the kids K2 together, 3-5 in elementary, and then we move to middle school. 6-8 is pretty much just 6-8. There's not a whole lot of deviation. There are times where we may do a 6-7 combo split and a 7-8 combo split, but we do with middle school because there's just 3 grade levels. That one is a pretty easy one. When you move on to high school, we do a 9-10, and we do an 11 and 12. Where this gets, where this changes and it fluctuates is that every year we have kids that are coming in and we have kids that are leaving. So one year you might have a pure 5th grade class because you have enough to fill a 5th grade class, but the next year some of those kids may have transitioned and gone back to their districted schools or moved out of the system, and so you have fewer kids, and so you would need to create a 4-5 split because you can't have a teacher and 2 pairs with 2 kids, and so it looks different every year.
That answers my question, but within those times that each year, it's a little, and I would think, when you think of some of our traditional public schools where they screen before the child comes in or what have you, and there's always diversity in every class. So I think that just explaining how you guys section it off so that it's evaluated each year to look at, okay, wait, something we may need to be aware of in this circumstance because we don't have the numbers. And so we'll be clustering a group of students. I don't know if that's true. I mean, again, this is not my area of expertise, so that's why I wanted to get a better sense of that.
It adds to that because they are a center school, they receive students from all over the district. And during a week or month, she might be getting 3 new 3rd graders coming from 3 different schools. So she has to go back to that group of teachers and reassess the type of students that is coming in with the needed supports and behavior. And that format of that classroom might change. That we experienced that last year because we had an enormous amount of elementary students that have never been in Sarasota, brand new to us. And we are also right now experiencing new students coming to our area because of Oak Park. Who need a separate day school are coming from a separate day school out of county and out of state. So she might have to regroup again and look at the format of those classes because they're coming in. And because our district support staff who are at the schools, and we have an amazing support in our schools from pupil support services because we are in their schools. We meet with those parents at that sending school, so we're able to transition and coordinate. But many times it's me calling or Tammy Castles calling Jamie. We have these 2 new students coming out, and they need to go to Oak Park because of the rigor and the law says we have to provide services. It doesn't tell us that we have to provide the same service in every single school. So we center a lot of our specialized supports at Oak Park. And then it's a balance about making sure that our teachers are safe, our staff is safe, but by when we meet with those parents and understanding what do the child need and how we can transition that to a safe educational environment. So those bands within that school and center are always looked at to make sure that that child is receiving the services that they need and that our staff understand what they need in order to keep everyone safe.
And is it the local, the ESEA liaison at the school that connects to Oak Park? I mean, because that's
sending school.
Yeah.
And then we have outstanding program specialists that support the local ESC, the school-based ESC liaisons to support then transition to Oak Park and provide staff development. And within her staff development plan that many of you have copies of the integration of the social emotional learning, you also have to understand that we have to provide continued support to our teachers and parents about specializing instruction because on the FAAA track of the House, these students are following Access Point curriculum. And Access Point curriculum is aligned to your Florida standards at each grade level. However, it allows the teacher to modify the curriculum and be able then to be responsive to the instruction. But later on, I'll tell you what we would like your support from when I have that opportunity.
Thank you. Thank you for explaining that.
One more clarifying thing, Bridget, just to further answer your question. So yes, these are broken down by teams, right? But there may be a situation always where a student has a dual exceptionality. So they have a primary exceptionality and then a secondary and maybe a third. And so we try them out on, say we have a student that comes in, and we just had this recently, has an ASD label, and then they also have an IND label. So when you look at the chart here, you look at the hierarchy, you try to figure out, okay, where is this student going to fit best on which team? And that takes a CUME file review where you have to sit down and you have to go through and look at all of the history of the student, academically, social, emotionally, that kind of thing. And then you call the sending school, whether it's out of state or it's across the street. You're calling to get some background information to really get to know the student, because you don't want to have to keep moving a placement of a kid. They've already been displaced. They're already coming into a new environment, and the worst thing that you can do to a student is put them somewhere and then have it not be the right place and then have to uproot them and move them again. So we really do due diligence in making sure that we have a very full understanding of the needs that the student is presenting with to place them correctly. I will not tell you that it works 100% of the time. Sometimes we place a student and we go and we follow up with a parent after a week or two, or the parent will follow up with us even before a week or two and say, you know what, I'm hoping for something a little bit different. I'd like my student to be challenged a little bit more. At the former school, they were able to do this, this, and this. Is there a way that we can replicate this at your school? And then we go back to the drawing board and we try. So we try to place them correctly the first go around, but there are occasions where we miss the mark because we don't know the student well at that point, and we have to spend some time getting to know them and know what their specific needs are.
Thank you. I read all of these charts, but I could not make head or tail out of this one.
That's why we need Lewis Weber to come and explain that. Lewis Weber,
He's great.
Our resident expert.
He's fabulous.
And he has authored that. That was a perfect segue into this, Caroline.
Good.
Yes, he is been working at Oak Park. I think Sonia has contracted him, and he's been at Oak Park for what, 15 years?
No, I haven't been here 50.
Okay.
Let me tell you about
15, not 50.
Louis Weber is a board certified behavior analyst, and he owns his own company. Louis came to us as a contractor and continues to be a contractor for the school district, but he services all our schools. Whenever a principal at any of our schools receives a challenging child that he needs to provide additional support to the staff at that school, we call Louis, and he's very responsive in terms of going into the school, analyzing the issue, collecting data, and then informing a functional behavior assessment and a behavior intervention plan, then train the staff in the implementation. So we are lucky right now that at Oak Park we have 3 board-certified behavior analysts. They're employed at Oak Park. Sometimes the challenges come to us from the family or for whatever reason an outside agency, so we contract also. We use an outside lens. Sometimes an outside lens can help us analyze what's going on, and we have to adjust, delete, or change. And that's how Louis has been working throughout the district. With the social emotional learning, it really is about what do we need, not to only keep ourselves focused and calm, but also provide that to the staff so they can implement programs. So because you have heard many of the initiatives district-wide with Civility Squad, Positive Behavior Support Services, CHAMPS, Discipline in the Secondary Classroom, he came into Oak Park from the lens that what does it look like at Oak Park, a separate day school? And that's when he worked with Jamie and her staff to see the framework. How are we going to conduct ourselves and improve the focus on the culture and climate of delivering services to students and families at Oak Park? Take it, Jamie.
Okay, so you have an abbreviated version. This was, at last count, 61 pages, and he hadn't even gotten to the parent component of this. And so, because we only have an hour to discuss, he was kind enough to condense this to make it a little more user-friendly. Because to a layperson, this looks like Greek.
Right.
We understand that. So really what this is an integration of behavioral systems that we use throughout the district. We have CHAMPS. which is new. And our faculty, we had volunteers through our PBIS committee last year that participated in the book study, the CHAMPS book study, both at the elementary and the secondary levels. And so we went through that whole book and we said, okay, wow, what does this really look like at Oak Park School? We were neck deep in our PBIS program, and we're really super proud of what we're doing with PBIS at Oak Park, and the kids have bought into it. And if you've been on our campus in the morning when we're doing morning announcements, you will hear that the students recite the Pledge of Allegiance, and then they go right into their Roar Pledge, and you may have heard our Panther Choir do that too. So really, this was just a group of people sitting down with Lewis's guidance and expertise, because he has years and years and years of working to integrate systems to support whatever environment is in need of support. And so this was simply taking, and I say simply, and it's not simple, it was not simple at all. But TPS, and I don't know if you're familiar with TPS, but that's Total Progress Systems. And that is a data collection mechanism that Lewis has created, and it's been in many schools in our district, where this is how teachers and paraprofessionals are able to track positive behaviors or negative behaviors of students and pull the data together in one place, so that you no longer have to sit with a piece of paper and make tick marks every time a student engages in a certain type of behavior. So taking the TPS data, it's vital at our school because it is used in the development of the IEP for our students, and taking that in combination with the BIP, which is the Behavior Intervention Plan, and then integrating our PBIS, our CHAMPS, Civility Squad. Again, if you've had the opportunity to be out at Oak Park, when you walk through our front door in the office, all of the Civility Squad characters are proudly displayed in our front office with graphics, and we practice Civility Squad daily at Oak Park. So this is a work in progress. I think if you read his overview at the bottom, he has been working on it for about 10 years, and then we've been working on it for the past 2, and it's about a 15-year implementation process. This was not intended to happen tomorrow. This is a strategic plan for moving forward and how we're going to incorporate all of these things that help support that social emotional learning piece, that behavioral piece that our kids so desperately need into just the culture and climate of our school at Oak Park.
And to integrate the family engagement, to bring families in as part of this journey. Because when we're dealing and providing such intensive support to students, our families need to be part of this journey. As they go home in the evening, they can take strategies and come back the next day. So this plan is a year-long professional development implementation that integrates those elements that we need to provide support to the teachers, so teachers can support our students, but most important, wrapping around parent involvement and engagement in the process.
I'm really glad that Sonia brought that up, because another important piece to this that has been modified for this year, we have recognized that it is essential for us to be having communication and conversations with our kids about where they're at academically, where they're at behaviorally, where they're at emotionally, because kids deserve to know. They have the right to know how they are performing, especially if they're getting a note home to a parent that says, well, out of 100 points today, Johnny only earned 45, and he did X, Y, and Z, and then the student has to go take the note home and present it to the parent and get whatever consequences are issued at that point. That is, we can do a better job at setting students up for success. And part of looking at this is, how can we allow students to be partners in their education, because they need to be. They need to know where they stand at all times. And how do we carve some time into our school day with trying to meet all of the requirements, all of the other requirements that we have to do, to be able to sit down and actually have a one-on-one, face-to-face conversation, teacher to student, twice a day, so that kids can start to, in their minds, say, okay, so you talked to me, I had a rough morning, I know that it's not appropriate for me to argue with you when I have to throw my breakfast tray away and clean up my area. I'm going to try to do better at lunch. But they've had that feedback. They've had that conversation. They know what the outcome is going to be if they continue to engage in the same behaviors. And then it's not a surprise when they're walking out the door at 3:45 when the teacher puts the home note into the folder and says, take this home to mom. Kids have to know where they're at so that they can go home and they can explain what their day looked like. And that's part of that feedback loop. They have to be responsible and take part in their education. And this is one way that we are providing them the opportunity to do that. What does that look like at the end of the day? Well, sometime around lunch, they have that initial conference with their teacher. Then at the end of the day, we were able to, through being really creative with our master schedule this year, create a unique skills block, and that is a course code that's designed only for ESE students, but every teacher has it at the end of the day, their 9th period. It's a unique skills class, and it covers that social emotional so that they do have the time to spend with their students. They're not worried about teaching math at the end of the day. They're not worried about reading at the end of the day. They have a designated period that counts as, for our high school kids, as elective credit, so that they can sit and they can have the conversations and they can talk about what the day looked like. The student can give their perception of what the day looked like. They can feel good going home with their home note, and they know what they need to do when they come back the next day to make it better. So that's a big piece of this, is involving the students in their education, the students and their parents in their education.
So, timeline, I want to give you some chance to answer some questions as a follow-up, and I know you have some asks of us before you leave.
Well, I wanted you to talk just a minute, if you would, please, about the new communications devices you have around campus, the new computers and technology that you're utilizing this year, please, because I think, kids love things like that, and having the ability of communicating better for those that are challenged with communications, I think is really exciting.
So thank you for mentioning that. We are super excited that we had the support of our IT department, Joe Benswanger and his group of people who came in and actually sat down, had conversations with teachers, had conversations with administrators, because quite honestly, just putting 50 laptop carts at Oak Park School did not put technology in the hands of our students. And so they came in and they sat and they talked and they walked through classrooms and they looked at what the needs were, and they created a plan with us and through Linda Seibel, through our refresh. We were fortunate enough to be one of the schools that was refreshed this summer, and we were actually able to pick appropriate technology for each of those teams that you just saw. So if there were students that needed touchscreen instead of keys on a computer, we put that in their hands in their classrooms. If there were kids who could handle being on a laptop and use it responsibly, then great. We put those in the hands of those students. We have a lot of Gorilla-cased tablets this year so that if frustration mounts and it gets banged on a desk or it gets thrown on the floor, it is protected and encapsulated so that it doesn't break on the first go around. And so we're not experiencing the kind of loss that we typically would be if they weren't protected. And then I have to tell you that our active panels, and that's probably not what they're called anymore. They change names every time. I don't know. Our active panels, but they not only did they refresh and give us brand new ones, the glass paneled flat screens in every classroom, but they came through and they made sure that the heights were adjusted appropriately for students who were in wheelchairs or had mobility issues. And they talked with every teacher and made sure that it was all positioned right to meet the needs of the kids so that they do have the opportunity to engage with technology. One of the other things that we were really excited to bring to Oak Park this year, and you'll see these at our sister middle schools in the district, are our classrooms of tomorrow. And we can accomplish core academics in this one classroom. We have a designated teacher that is in there to provide support all day long. And she teaches classes, but she also has opportunities to team teach with teachers on the different teams, to have kids come in and work on language arts, to perform science experiments, to solve math problems. And it is giving kids the ability to work in a community-based setting where they can have a team of their peers at the table, working alongside one another and really engaging in a different way in their education. So technology has just, we're off the charts with technology this year, and we're all really super excited about it.
Well, the campus looks great.
Thank you.
And the media center looks fabulous, and your offices and so forth, the front facade of the building. And then, of course, you've eliminated a lot of the barriers that were inside those various wings, and now you have the outside and outer fence, which I think is so much better. And we talked to Tim Enos about coming out and speaking to parents, because there were some concerns with parents about access and why they didn't have the same access they had before with classes. But again, we have to do and keep our students safe. But I think that the campus looks phenomenal. And I attended a meeting with some Farm Bureau people, and we were talking about some of the things that you're doing there and about our garden that we're building this year. And so I hope maybe we can have some interplay, because now we've got Sarah Dan on the Ag committee that I kind of put together because I thought that was important for her. But I think we want to include Oak Park in this as well.
We definitely do. Thank you for recognizing that the campus looks fabulous. I don't know if Jody is still here. Did he leave? He left.
He's busy working.
Okay, he only had a couple of things to do today. But we had the opportunity to have a new custodial crew take ownership of Oak Park campus in November of last year. They came on as a team, and we are so proud to let you know, if you don't know already, that they were awarded the White Glove. They got 100% perfect inspection, which is almost unheard of, and they will be competing for the cleanest school in the district. So it definitely has taken on a new shape. We love our horticulture program and our agriculture program that has started. We've put a culinary class in this year so that kids can be learning the life skills necessary to create meals for themselves, and maybe take that a step further and look at that as some type of a career path for them. So there are a lot of really great electives courses that have been put in to give our kids exposure. So yes, thank you for pointing that out.
So I'm going to take over in terms of how you can help. In summary, Senate Bill 1108 created a lot of additional barriers in the world of exceptional student education. And I always, tell Jamie, this is not a school of special kids. This is a school of exceptional students. And because they're exceptionals, the barriers that the new regular diploma option access placed on us is our students with the most significant cognitive disabilities must take EOCs and are held at the same academic standard as a gen ed curriculum diploma. So if you were to ask me in terms of the challenges, I really would like for you to further investigate opportunities that we can look at the option for regular diploma access and eliminate some of those additional barriers that prevent our students from having opportunities for internships like we used to have before under special diploma. They do don't get me wrong, they do have some limited opportunities about life skill curriculum, but we're held at the same standards as our students in the academics, and again, having end of course exams in biology, social studies. We have a wheel, so that to me is a great challenge for our students who are cognitive significant delayed. The other challenge that I would like to as you move forward in legislative intent is to eliminate it's only in Florida, this was not a federal regulation, that in Florida we put another barrier whenever our IEP team, and IEP are the ones that make recommendations for services on students, they put the additional barrier of having an additional consent from the parents. So if an IEP team meets and make recommendations for exceptional student education services, the parents have to give us permission. If they don't give us permission, then we cannot move that student unless the district file due process or we go through legal processes in order to provide the needed services that student needs. And the third request, well, I have two more. One would be, I'll follow up with an form to you all, is they also, under this bill, have the districts use a coercion letter, which indicates that the district has never prohibited a parent from bringing anyone that they want to a meeting, which we have never, but that's statewide. That's something that adds to the processes, which prevents a barrier, because at the end of the day, we invite anyone, the parents can bring anyone to an IEP meeting without any adversarial effect to that. And the last one that I would like you to remove the coercion letter. Doesn't make sense. And we need that every single IEP we have to have parents sign on that we have not prohibited them from bringing anyone to the meeting. Just another additional form only specific to Florida. The last one is a local request to look at Oak Park, and we're the only school that does not have a track and field arena. So when we do the largest fundraiser sponsored by our parents and families, our children in wheelchairs as well as ambulatory children, we have to go through the fields many times and infected. So just a thought for food when you're looking at facilities. Again, our facilities and all the integrated supports, it's magnificent what we get in the support to Jamie and her school and the teachers and the staff, but facilities need to look at.
So with the swimming pool, with the gymnasium, if we added a track there, we could even host the Special Olympics.
And this year we were able to.
We could even host the Special Olympics there if we had the track. So that would be. So
the big announcement
that's
is
where it should be held.
Yeah, the National Special Olympics contacted me and invited Jamie to join me this coming Friday evening at Benderson, because they want to come back and really do. I'm partnered with Sarasota County Schools, and Dr. Bowden connected me to the national director. So I received, and I'll be attending to see how we can enhance. Jamie started some teams. We have an active swimming team in the area of Venice with Special Olympics and bowling, and I really would like to use this facility to showcase, because facilities also were able to help us get the wheelchair specialized lift for the swimming pool, since we have a therapeutic swimming pool. So this year we begin and open the facility, allowing our children on wheelchairs to be able to access the therapeutic. So I thank you all, because things are great happening. It is a journey, but we're excited, and every day when I see the teachers and paraprofessionals at Oak Park, you need to understand they're dealing with the most challenging students that we get in our district, and they're there with a smile, and they will continue supporting our children, our families, and we're here for them. And I thank the district staff, because again, when they call, we're there for them. So thank you.
So you would like to add those things to our legislative priorities, and you will have a copy of that for us. And I think that's a really great idea.
What year was SB 1108?
It was Senate Bill 1108 was 2014-15. Okay. It started with the access point. And that really impacts our work structure program, the bands of academic demands, that we're seeing, district-wide, because teachers are held accountable in the academics, and yet we have to teach life skills for our most significant students.
So that was the 2014 legislative session because the board rule was October of 14.
Correct.
So it couldn't have been 14, 15. It would have been, anyway, the 14 legislative session. So
15, 16 would have been.
15, 16 implementation.
Correct.
Do you have the relevant Florida statute that you want to change?
Yes, we've cited 2 Florida statutes and a board rule in the email that preceded our last board meeting. I'd be happy to resend it. It's also got those subutilization numbers that you talked about before. So I'll resend
yeah, now
it.
I remember. I do remember because you put the statute in there.
Yeah.
Yep.
And we can have if it's. So you're going to write this all down. There's one that I obviously want to talk more about that
We will.
probably won't. but for us to, as far as whether or not we put it on legislative agenda.
Yes.
Okay.
Anything else?
I don't think so. The parent-teacher organization there at Oak Park, she is Jamie's taking the lead.
And we're going to go with the PTA.
Yes, ma'am. Dr. Bowden supplied me with a name for the state contact. I have reached out to her, expressing interest because I know that Inglewood Elementary.
Yes, they're a star in the PTA world.
And we would also like to invite their PTA president to our meeting to help maybe provide some guidance and getting ours off the ground. And so we're looking forward to getting that initial meeting scheduled within the next couple of weeks.
Wonderful.
Congratulations.
Good job. Good year. We'll be out very, very soon for a visit.
Thank you for the opportunity. Appreciate it.
The 5K walk run.
Okay, moving right along, we have our Staff Safety Committee coming up next with Dr. Laura Kingsley, Lynn Peterson, Tammy Cassels, and Michael Santagata. Santagata, is that correct?
Very well.
I'm sorry, I want to make sure that I pronounce this correctly. You need to move up to the front.
He's going to.
Oh, he's going to?
In
Okay.
just a minute, yeah.
Okay.
So we got this all.
Got it?
Yes.
You got it choreographed? Marvelous. Marvelous, marvelous.
And we'll try to make
Speed it
part
along.
on this fast. You got the notes. The superintendent requested us to put together a staff safety committee, which we did. The members of the committee are listed on the notes that you received.
Yes.
And so how we want to handle this presentation to you is to think about a few things in those notes, some of which have been addressed by another committee that we have put together the end of last year, which was a behavior summit. But we also then want to have Lynn go through the workers' comp, which I know you were very well aware. Unfortunately, it was reported both in the Herald Tribune. Oh, he stepped out incorrectly, but there were issues with the number of injuries at Oak Park that did increase. So we focused almost our entire committee on the issues that we were experiencing at Oak Park. And I want to apologize. I had a mindset that it's workman's comp. So I have workman's comp throughout this whole thing, and I realized, oh my goodness, it's workers' comp. I'm like a decade or so behind. Lynn's also going to talk about the wellness plan, but since Erin went into great detail, I just want you to know that that was an initiative that was really highly discussed at our staff safety committee meeting. And so I know you focused a lot on Oak Park. Then Michael and Tammy are going to talk to you and maybe even demonstrate to you a little bit about what the training is for CPI, for controlling our crisis prevention intervention, which should be fun. Another thing that I want you to understand is the superintendent charged us with getting some really clear communication with our staff on what does it mean to restrain a child, how will they be supported in that, in what circumstances is it okay. And so the committee asked Art to give a little short synopsis, which we love Art, 6 pages later. So Tracy Beaker, the Master of Words, is going to try to get that in a form that our staff will be able to clearly understand when and how and the legalities of necessarily having to put your hands on children. And then
I think I had a conversation with Bridget last week. In Art's research, he uncovered a committee that was formulated in 1999 at the Florida Department of Education to clarify when students can and cannot be restrained, and that committee gave up without ever publishing or meeting their obligation from the legislature. So many have tried and failed. We are going to make this work. I think we owe it to our teachers to provide clarity, not only of when they may, but when they're obligated to act. But it's not as simple a question to answer as it is to pose.
Can I just, and I know I shared this with Dr. Bowden, and he may have already relayed this, but similarly in the home health space or assisted living space, there are a myriad of, and so I'm thinking through like Arthur Gallagher, if the brokerage has any kind of pre-loss elements, it would be very similar to this discussion as far as rules of engagement, how to mitigate risk and injuries, but also from a liability standpoint. So has that been something we've looked at?
So we have not looked at asking Arthur J. Gallagher.
Because I feel like a lot of times those resources are available without us having to pay. Maybe sometimes they'll charge you, but it may be something that would be as a good guiding process that we could implement and look at it from a structural standpoint.
So certainly we can ask them. We've asked them about their safety expert who we've been working with for the past year on the workers' compensation claims and different departments that are high-cost drivers for claims. So we've been working with them with that. With regard to the student safety, I don't believe they have it, but they haven't offered it. I don't know that that's their area. Okay. And it's probably more on a legal
side.
Thing. Sure.
Mm-hmm. Okay.
So go ahead. Let's look at your first handout.
Yes, so the workers' compensation claims, we responded to a public records request for claims for student versus staff. And just what was given per that request was had to be a manual process, just letting you know. We were already in the process because we're doing an occupational safety program that you will hear about. I'll probably be back next month to talk to you about that. But we were already in the process of digging through 5 years of data, and we had to clean it up in order to identify what is our risk, what's our drivers for workers' comp. So in that process, we already had 5 years of data segregated out with regard to the medical. We went through that and added the 18-19 when the request came in March, and went through that to include the student versus staff in that data. Unfortunately, at the very end, the filter wasn't, we didn't filter out the report onlys. And as you can see on the first page, workers' compensation claims are reported in 3 buckets. There's an indemnity, there's medical, and report only. Report onlys are just that. They report and there's no treatment. Although we encourage that because in 3 days, possibly 2, so at some point in time, they may feel an injury from that report, and it may turn into a medical claim. So report onlys can turn into medical claim, but most of the time, they remain as that. So we separated out all the data. We provided the report onlys for all of the prior years, as you can see on that first page, so that you could get a true feel for the student versus staff aggression type of claims against our staff. The ones that incurred medical costs, which are the indemnity and the medical, and the ones that were just a report only. So now this is more of an accurate picture of the claims in that category. Of course, we have a whole lot more claims from trips, falls, and that sort of thing, but these are just the ones with student against staff. And
so, Lynn, when it was first reported to the public records request and then in the paper, this year's data had included reports only, and so it looked really
inflated.
Elevated, and the fact is it wasn't
correct
elevated compared to the last year by much.
This data has been updated for the year end for the fiscal year end. So we've included from March, when the original request came in, we've added the additional claims. So you've got the full claims that have occurred during that time period for all those years. So now you can see there, if you look at the second page, we've broken it out and we've added by positions like administrative or classified, instructional, and we've added the cost component at the point of June 30, 2019. Obviously, these costs will change over time because there are still open claims that people will continue to treat. But at the end of the fiscal year, this is the cost that we've incurred for all of these types of claims. And it's broken out. You could see the percentage of all workers' comp claims, and we've included those report onlys to give us a true number of all of the claims. So you could see that 33% of the 627, without my glasses again, I'm having the issue with the lighting. It's that percentage of all workers' comp claims are student versus staff. Any questions on those slides?
The middle section is all total work comp claims. You said you included report only as well on that one? Okay.
Yes. And you can see the breakout on the page, the prior page.
Right.
In terms of nationally, actually, Michael's forwarded me a research article, and nationally, the average is about 26%, but that does not cover a school like Oak Park, where there are higher possibilities for staff injury due to some of the children's exceptionalities.
If the attached slides break it down by each cost center, so you will see that the numbers, and we already had identified Oak Park as one of our high drivers for the occupational safety program, and we were already in communication and meeting with Jamie and training her staff on investigations and that sort of thing. So this was already in the works, as Jamie could attest to that, and looking at her campus and that sort of thing. So we were already in the process of working on this when that public records request came in.
And you're also planning another high injury is lifting, and especially at Oak Park,
yes,
that impacts them?
So, yeah, so through the whole data research that we've been doing to identify throughout the district, we have identified lifting as the high cost driver. That is where people are incurring back claims that are costing the district a lot of money in workers' compensation. So we've identified that as something that we wanted to target initially in the occupational safety. So we've already met with facilities. We've done training for lifting with the custodial staff. We've gone out to, we've met with Oak Park to see, well, what is your lifting claims? And their lifting claims are lifting students. So their training is a little bit different. So we are now investigating how can we train, because we found that they're not being trained. That nobody is being trained on how to properly lift. So that is part of our focus on, and it's peeling away the onion of the layers. There's so many things you can do in a safety program, but we've identified the top priority, which is costing the district. So we are working with SMH and with STC to get proposals for what would it cost us to be able to properly train the employees over at Oak Park on how to properly lift and use the equipment that they have available to them.
Eric?
No, I understand that Oak Park represents a high concentration of the numbers, but the question is the growth rate. Because you had Oak Park in 13-14 when the total count was 128. You had Oak Park in 18-19 when the total was 209.
Right.
You had Oak Park in both of those years.
Or even the 50 and 50.
Yeah. So the question is what's the explanation for the growth?
Well, I think as the reason for the safety committee was to try to uncover what is it. This is not a number, just to go back on workers' comp. This is not a report that you can just pull from the data. When we get reports, you just don't pull student versus staff. We had to go through and do a manual process of every single claim to find students. So
but that was the main concern. The main concern is it had gone up. Not that the actual number is what the actual number is. It's the
growth.
It's the growth, the delta.
And we see that
Oak Park doesn't explain the delta because Oak Park existed at the beginning.
Well, I think from what we've uncovered that some of the issues, maybe what we're going to cover here from the safety committee, was some possible training for our employees on how to properly handle the students.
So they had the training in 13-14, and the people who had the training retired and left?
Well, let me tell you one thing in 13-14, and I'd have to ask Sonia, when we transitioned the high school EBD unit over, because you can see in 14-15, 99 of those student injuries, that was a pretty high number, and that one of the explanations is we did transition that whole high school EBD unit over to our regular.
I was using 13-14 because it's a larger range, but if you wanted to pick in the middle, I mean, right after that, I mean, you see 133 in 16-17, and then it went up to 193 total.
What page are you?
I'm looking at the front.
Well, that's not just.
Go to page 8.
Okay.
I think that's more relevant.
Yeah,
that's only Oak Park.
Page 8. Page 8.
No, I was talking about the total.
The total.
I was talking about the total.
We also have more staff.
Because Oak Park existed in the beginning, Oak Park existed at the end.
Increase.
Yeah.
May I just say one thing, and then I'll go back to my seat? It's on, sorry. I'm probably not close enough to it. This is Mr. Cantise's seat, so that's probably why it's not working. We have had a significant increase in student enrollment as well, and I think that that is something that has to be recognized. In addition to the increase in student enrollment, the students that are coming in crisis and in trauma also exacerbates the claims, because if those, again, and I go back to that social emotional learning piece, if we are not meeting kids where they are at, and we are not equipped as educators to be providing supports that they would receive from outside agencies within the school setting, those types of situations are going to increase. And I think that that's what we've seen.
So if I hear you correctly, what you're saying is I'm on page 8, 15 just in Oak Park, 15-16 went from 49 to 94, and that change is attributable to not just the growth in Oak Park, but the mix of the students that we received at Oak Park?
Yes, I would concur with that. Yeah.
We would have to go back and look at every single one to give you an accurate answer, Eric. But the point of this committee was to look at the patterns and then say, what are we going to do about it? So I'm looking forward to her talking about the wellness and Michael talking about the plan that we have for professional development, if we could move forward, because I don't think Lynn's team looked and identified patterns that would have to be done jointly with the staff. You did look at what
we can look at the claims.
Well, just you show me number. I'm a CPA. You show me numbers.
Yeah.
You show me a trend. I'm going to look at that.
Yeah, we would have to look at.
I understand what Jamie said, and what Jamie said made sense.
Okay, good. Okay,
and I didn't have a follow-up question. I just paraphrased what she asked, and I moved on.
Okay, good. Okay, so let's talk about the wellness plan.
Okay, so the wellness plan, which Erin had presented earlier today. So we came up with this through our safety committee, and really just what's going on in current day now. The focus is on mindfulness and well-being, and so it was what is happening in wellness today, and so we brought that over to focus on programs to help out the staff at Oak Park. We didn't want to forget about the whole district, so we developed the program to include all employees, because all employees feel the stresses just as they do, but Oak Park staff has a little bit more stress sometimes on a day-to-day. So all of the programs are available, and we'll have some of the programs right on site at Oak Park. You can see from the first page that we've provided that Oak Park, the only thing that all the other district sites won't have is the in-person EAP seminar that was already given at the start of school. We wanted to really give that information out to Oak Park staff to know that when you need to talk to somebody, you can call our EAP program. And so they had the person come in. It went over so well that we're looking to bring that in for our health fairs, to be able to give that information out to all of our employees. So we'll be expanding that. But we have the on-site yoga classes to help with relieving stress. We're going to have the counselors come in and be able to have employees have an opportunity to meet with them one-on-one. And the challenges and everything that we're going to do in this program is going to have a component at Oak Park directly, where outside staff will be invited to join, as well as having it on other campuses and other locations.
And you weren't here, but Bridget asked that specifically. How can we improve the wellness of the Oak Park staff? So Jamie went into it.
Yep, so we're doing all those screenings. We're focusing on helping Oak Park with their very stressful environment that they have.
Good. Okay, so thank you, Lynn.
Thank you.
You're done for the day. And while Michael and Tammy come up, I want to reference the Behavior Summit. I'm excited about two things that this group did that is not focused specifically on staff injury, but on student behavior that we know could lead to staff injury. And one of the items you're going to see, because Todd saw it this summer with our administrators, and that is our whole focus on high expectations teaching. And the staff worked so hard to create really great infographics that are live links. And so Todd asked for those things to be brought to you at each meeting, and I'm looking forward to doing that. The other thing that I want to mention that the safety committee requested was some sort of flow chart for a teacher. If a child does this, what do I do? And that gets into the whole challenge with creating a restraint document that is succinct and easily understood, because children have many, many different behaviors, and you cannot predict exactly how it's going to go. So as an outgrowth of the safety committee, the Behavior Summit folks are going to put together a toolkit, and that's going to be easily accessible for our teachers. So we're looking forward to bringing that to you. But now, as an answer to Eric's question, what have we done at Oak Park? What do we need to do at Oak Park to try to reduce those staff injuries? Tammy Castles and Michael Santagata.
Hi, good morning. Okay, so we will begin by reviewing the plan in place to continue to provide CPI trainings across the district. And they have this document?
Yes, you have it.
So just yeah, this document. Yeah, I have extras if you need it.
Probably do. So I'll order over here.
We have extras.
Don't hold up on me.
Okay, it's okay. We'll go over that first, and then we'll review the Oak Park data regarding the CPI trainings and the workers' compensation claims. And then finally, as Dr. Kingsley mentioned, Mr. Santagata and I will provide a learning opportunity to allow for a deeper understanding of how CPI strategies can be utilized in the classroom. So if you look at the document that was just provided, if you look at the CPI initial training, there are 15 trainers district-wide, and this is set up so it's a continuous cycle, and participants will earn their CPI certification by completing 6 hours of initial training, and then additional certification is provided by completing the advanced physical training. So in July and August, there will be 6 hours provided to those participants that have not received it prior to that, and then we'll just continue to go on to provide the 3 hours, and you'll see how it's laid out there. And then once we get to March, during that professional development day, the trainers at each site, there are 2 at Oak Park. Mr. Santagata is also a trainer, and then we have trainers designated for each behavior cluster site as well. And those will take place in March, and then those individuals who are new hires will come back around in July and August. So it should be systemic, and it should be a continuous cycle as we work through this process here. So in addition, CPI initial trainings and advanced physical trainings will take place at Oak Park every month moving forward. Any questions about the actual training cycle there? Okay. Presently, 341 district staff members have current CPI certification, and then specifically you can see everything that's broken down there as far as Oak Park staff.
And how long is the certification good for?
We say it's good for 2 school years.
Oh, you say that?
Yeah. Where CPI actually allows us to make the determination locally as to how often we see it. Although we do recommend that teachers that are either in cluster programs or working within the center-based schools, that they take it every year. Yes.
And for those of you who do not have a piece of paper there in front of you, CPI stands for Crisis Prevention Intervention. So for everyone else, yeah.
Yeah, and I'll go into that and define, I think, if that would be okay. So crisis prevention is something that we've been using in Sarasota County since the early 90s. And basically what it is crisis prevention. And what we really try to do is we really try to teach teachers how to identify behaviors and how to respond accordingly. And it's all on prevention. So very little of the program is actually based on physical intervention, but most of the program is based on what are good strategies that we use for kids so that we can get kids to basically comply with what it is that we're requesting. So CPI, it's a 6-hour initial course, and in that 6 hours, what we really do is we really teach teachers from the very beginning, how do you formulate relationships with kids? If you don't know how to formulate relationships with kids, we'll teach you how to do that. And we've kind of worked on, as the years have kind of progressed, we got into the works of Hattie, and when we realized what Hattie had is the largest effect size, or one of the largest effect sizes that you could have, was positive student interaction or positive student relationships. So we really operate off of that as our basis, and then we start forming off our crisis de-escalation based off of what we see. Okay?
Okay, so would you like to go over and turn over and talk about the actual data analysis of the compensation claims at actual Oak Park? Yes, sir.
All right, the graph that you have in front of you is a result from the workers' comp data that we had with regard to just Oak Park. So my charge was within the last year to kind of break down that data and see what it was that we had. Once I kind of disaggregated the data, then I used that data during our presentations that we had for Oak Park staff, the training that we provided for CPI, which basically occurred from April all the way through last week. So we've done, I think you have the trainings outlined somewhere that we have, but we've done trainings in April, May, June, July, August. The pre-training week, we did trainings every day during that time. We have training scheduled for Thursday, I think, at Oak Park. And then
additional.
We have more training scheduled with bus transportation, and then I will be out there once a month. And then in addition to that, I will be out there to do morning trainings as well. So our goal is to make sure the entire staff at Oak Park is trained under CPI. In addition to that regular CPI that we have, which is the 6-hour training, we also have additional trainings with CPI with positive behavior support, and we also have the advanced physical training. And I'll kind of detail the advanced physical training as we move on. And basically, what the advanced physical training is it doesn't necessarily teach us how to reach strained children, but it teaches us more so how to safely manage, I think would be a better term, and how to keep yourself safe without having to engage in physical restraint. But if we need to, we teach those avenues and we teach those techniques as well.
Yeah, and I think it's important to say as well that that all of the behavior cluster site teachers and paras are also being trained or have been trained.
Right. Something that was, I think, important for the board to be aware is the bottom graph that we have, and you kind of see reported actions, and it's divided into different kinds of personnel. and you see how it has classified, instructional, sub-teacher, sub-parent administration. The reason why that is important is what we did as a staff, as a supporting staff, is we identified who those people were working with Oak Park, and then what we did is we brought some people in not during their duty day, outside of their duty day, so that we could make sure that they made that training available to all personnel. So we're also still following up to make sure that all these people are done. Especially important, you see, that we had the sub-teachers and the sub-paras who aren't usually part of that professional development process.
For school year 18-19?
Last year, yes, sir.
And we had some additional dollars to pay folks to attend over the summer and to pay our subs.
That was SEDNet funds and Fiddler's funds.
And some of these had duplicates? Because this adds up to 96, and this adds up to 94.
Could be timing. When data was exchanged.
Okay.
Well, it actually is, I think it's where it says strike grab combo at the top. There was a couple of them that kind of overlap, so I kind of included in their own category.
He's talking about the graphic that Lynn had.
Oh,
So
yeah.
she just recently updated that.
Okay.
So I know you want to share with them what CPI looks like.
Am I allowed to stand up?
Sure.
No, you must sit.
I must sit? All right.
You want me to stand?
No, if you could just
If
kind
you
of
could
say
talk
everything.
loud so the mic picks you up.
Okay. And I'm actually going to be the student, and Mr. Santagata is going to be the teacher.
So,
You want me to do it instead of
no,
her?
I'll use you. I
Yeah,
promise.
use me.
No, you can sit down though, but I'll use you.
I can be unruly. That's not a problem.
Do you know he predicted that you would want to participate?
Yes.
I'm surprised Zucker didn't nominate me. Go ahead.
All right, so when we talk about CPI, the basic model that they start with is called the crisis development model. And again, we're working off of that positive relationships with kids. And they define behaviors into 4 categories. And those 4 categories are anxiety, defensive, an acting out person or a child that's at risk, and then the last is what we call tension reduction. So this is like a 45-minute lesson that I'm going to try to do in hopefully 5 minutes or so if I can. Basically what we say is we notice kind of like a child walks into the class. So let's say Eric's walking into my class, I have a relationship on everything that's going on with the kids that I have, and I notice something's different about Eric today. His head is down, so I'm thinking as a teacher, I'll use Tammy, but I'm thinking as a teacher right now, something is up with, and I'll use Tammy, something is up with Tammy. So I don't know what that is, but I just know that from my 20 students or whatever I have in my class, that there's something going on with Tammy. So go ahead, Tammy.
As a student, I'm thinking that I'm sad. My parents were fighting last night. I went to bed without dinner, woke up this morning, and I'm really struggling because we had to rush out the door and didn't get breakfast as well, and I am struggling this morning.
Right. So obviously I have a number of things that I can do, but the first thing that I want to do is kind of make conversation with Tammy. So I want to ask Tammy if everything's okay. I want to see how it's going. I want to ask her about her game last night, something like that. So I don't necessarily bring absolute attention to what's going on, but I am showing her some level of attention to see if that's what it is that she's seeking. There's other things that I can do as well. Right now, I did everything that I was supposed to do as an instructor. But as you're going to learn kind of as we go through the lessons of what we're doing here, the ultimate behavior lies with the choice with the child, not with us. So we do everything that we can, but even if we do everything we can, her behaviors may escalate. And in this case, Tammy's behavior escalated. She becomes what's called a defensive person. And when you're in the defensive stage, you start to lose rationality, you start challenging, and now I as an instructor have to think, okay, Tammy is no longer in that anxiety phase where I have to be supportive and empathetic with her. Now all of a sudden I'm to a point where I need to be directive. But I'm going to be directive in an empathetic way. So I may have to set limits. I may have to intervene. I may just kind of do pivot praise, where I may just say, Eric, you're doing a great job over here listening. I like the way you're doing it, and kind of give that back and forth. I may notice that Dr. Kingsley over here needs a little hurdle helping, so I'm going to hurdle help her through things. All the while, I'm giving time and space to the individual. So Tammy?
As a student, I'm still thinking that I'm in shutdown mode, and as much as I care about Mr. Santagata, and I know he cares about me, I can't figure out how to pull myself together.
Right. So I'm going to consider what we call function of behavior. And what function of behavior is what I'm trying to assess is what is she trying to communicate through her behavior. So I have 3 functions that I'm going to work on. One is attention. So I'm going to ask her, or kind of walk up to her and kind of make, again, that attention. Is there anything you need? She's not going to answer me. She's going to be still in that state of not responding. So now I'm going to step back and say, a couple minutes later, do you need a break? I'm going to ask her for escaping. Is she able to escape? She may not say anything back. And then the last thing I'm going to basically say, is there anything that you need or you want, anything that I can give you that's going to help you? Again, it doesn't work. her behaviors continue to escalate. And right now, I need to understand it's not me. So we had a parent at one of our local high schools who had children who had a sibling that was a sibling that passed. And the mom basically said, listen, if you're going to ask my kids to do things right now, they may not respond. And I think we kind of did a nice job at this earlier in the presentations today. So what am I doing? It's not me. So I'm giving her that space again. I'm letting her know that I'm there, but I also need to set limits. I have a classroom to run. There's things that I have to do. So do I call for support? That's another avenue I can do. Do I need to clear the room? Do I need to escort her out of the classroom? All those things kind of come to play. So even though I did all those things, her behavior still escalates. And she becomes what we call an acting out person, or a child that has at-risk behavior. And in this case, let's say she starts injuring herself. So if she starts injuring herself, I still need to prompt her. I still need to kind of see what kind of help she needs. I need to do all of these things, but in the meanwhile, if she presents herself in imminent risk of serious bodily injury or death, then I'm compelled to do something. So we say it's inherent in our position as educators to keep kids safe. That's what we respond, that's what we do. If she's placed herself in that imminent risk of serious bodily injury or death, I have to respond. Now, I don't have to restrain, but I certainly do have to respond. So if she's biting herself, I have to kind of do some technique that's going to help her. And what we teach through the training is we teach them how to properly respond. And it's not going to take care of every scenario or every situation that we come forth, but we are going to teach techniques that they can apply over a broad spectrum. Is it safe? Is it acceptable? Is it transferable? And is it effective? And if it kind of fits all those guidelines, then by all means, we want our teachers to do that to respond. Okay? The end of the lesson is basically that we have children that enter those stages. You may, as a teacher, have the child in the defensive stage right from the beginning. You don't necessarily work up. You may walk into a child that's physically aggressing. But our goal is to get those children to what we call tension reduction, which is where they can then be reintegrated and where they can participate back in the classroom. And so that's what our goal is every time that we do with our teachers. We want compliance, we want our kids participating, we want our kids in the classroom. Okay? Okay.
Do you want to describe a little bit of the advanced physical training of CPI, the additional 3 hours?
Okay. Okay. So come on up here. So in the advanced physical training, basically what we're teaching is we're teaching two things. The first of which are basically a series of how to escape or how to keep ourselves safe from what we call strikes.
Wayne's gonna come and get a picture.
So like a strike. So if Eric was to go ahead and hit me over the head, so go ahead and hits me over the head, we teach teachers how to effectively block. And you got to understand, when we teach teachers how to block, we're also teaching them how to place themselves in a position where they're going to keep themselves separated. So we're not engaging children at this time. We're just blocking and moving. So as he was to come strike me, I'm going to make what we call an L shape out of our arm, which is a rigid L is what we say. And basically what I'm offering is the fleshy side of my arm. So when he meets the blow, it doesn't cause injury. So everything that we do in mind is to keep the child safe. So he's also coming after me, so I may do this, but as I do it, his momentum's going to take him this way, and I'm going to bring myself this way. So as you can see, there's not engagement at this point in time. So we have different kind of strikes that we have. We also have holds. So if he was to go ahead and grab a hold of my wrist, that's fine, grab my wrist. So if he was to go ahead and grab my wrist, what do we teach our teachers to do? Well, obviously, we want to go least to most with everything that happens. So he has a hold of me now, so he can do some damage. He can hurt me, he could strike me, he can do whatever he can. First thing I want to do is ask him to let go. So if I say let go, he may let go. Or if he grabs me, then we teach different things, but it always starts with stabilize the grip. So he has a grab, so we teach basically a stabilize the grip. We teach basically where's the weak point of the grip, and we identify that's between the area between his thumb and his forefinger. And then we're going to turn the skinny side of our wrist, and basically we're going to teach teachers how to pull themselves through. If he was to grab me with this way, it might be something, go ahead and grab hard.
Like this?
No,
Like this?
Yep. And basically it's just kind of moving your elbow to different places and then repositioning ourselves. We teach teachers that we want to always be in this position with regards to aggressive students. Because if we're in this position here, with my hand slightly above his elbow, so go ahead and elbow me in the face, I've got a position where I can protect myself and then again step back. So 90%, I would say, of the program is based off of separating ourselves. It's based off of creating space. It's also based off of positioning. So if I position myself here, that means Eric has the door open, so he has a way to exit, and I have the kids behind me. Whereas if the kids were over here, I obviously don't want to place myself here, because then Eric has an avenue to aggress towards other kids. And then the final thing that we teach is we teach a couple of actual escorts and transports and holds, which always require 2 to 3 people. Okay?
So do we ever teach them to come behind and grab them like in a bear hug?
No, but we teach how to get away from that.
Okay.
Oftentimes, like, if you could just sit down real quick. So, oftentimes, like at Oak Park especially, when we're working with kids with autism, we may be in a position where we're doing some kind of discrete trial with them, where we're sitting across from the table. Now, he doesn't want to do what I'm asking him to do, so he may get angry, and he may want to say, I don't want to do it. But if he says he doesn't want to do it, he may not have the words to say, I don't want to do that right now. So he may lash out with his hand, so he may go ahead and try to grab my thing. As he does so, I may just steer his hand back and say, here, we're working right here. So I'm not going to make it a big deal, so to speak, because I don't want him to understand that if he does do this, then he gets a reaction from me. Then I'm going to actually teach him.
Mikey wants the mic.
Then I'm going to actually teach him that aggressing may get him out of it. I think so. It's very detailed. There's a lot to it. I'm happy to show you more. Anytime we do trainings, you're more than welcome to come. It does get physical in the training, so we do ask that you dress comfortably and appropriately for it. Dr. Bowden has kind of put me there once a month to assist with the trainings to help out with. I really enjoy doing it, really enjoy the Oak Park staff. They're happy to listen, they're happy to participate, and we just got to really kind of make sure that we get everybody involved, and then, in my opinion, the more trainings that we have in this kind of thing, I think you'll start to see that your numbers, that trend will go down.
So teaching really is rocket science, isn't it? I mean, aside from knowing their content, understanding that in stressful situations you can react calmly, that is a skill that has to be taught. It is not natural.
And developed.
Yes, it's not a natural inclination when someone's coming at you. It's not your natural inclination to redirect and say, let's continue to focus. It's rocket science. And the teachers at Oak Park are highly skilled, and we're excited to provide additional training with CPI so that they can get practice in role-playing with masterful teachers like Michael and Tammy. Thank you.
Say one more thing. Michael, is it true that the 6-hour training, there's a lot of verbal de-escalation strategies, right? You mentioned a couple of them when you walked around.
Yes, absolutely.
But there's a lot of that in the 6-hour training. So before you get to that part, it's that's really stressed upon. And then
Kami, I have another question about something else, but you might know the answer. I know that a couple of 3 years ago, I took a course in USA Suicide Prevention and USA Health with Sonia and you all at an in-service day.
Youth mental health.
I know that's being resurrected again, but I know that every employee must have 5 hours of mental health training.
Every student in grades 6 through 12
correct
have to have 5 hours of instruction in mental health, and our curriculum specialists and team have worked out a great plan that we will be presenting shortly to you.
And that is true for all employees as well, correct?
All of our employees had,
along with us.
All of us. This year we engaged in the Cognito training. Did you take that training yet? It's actually very good.
Haven't been able to do that.
It's well done with some...
Is there time for me to sign up for that?
Yeah.
Yes. And
all right, so quick reminder, training's all day on Friday. To enter the training, you have to bring your certificate. So you need to do your hours worth of online training before you arrive on Friday.
You'll enjoy it.
And it is required of all employees of the school district, and we have clarified it does pertain to board members. So.
Great.
And then over the next couple of years, we need to have all of our staff engage in the youth mental health first aid training, and we have plans for carrying that forward at post-conference and pre-conference days.
Yeah, they have one at 3 o'clock.
It's very good. You're going to enjoy it. It's well done.
I'm all for it.
Yeah.
Got to finish my thing.
Good. Are there any questions?
more of a comment. My first job out of college, which was many, many years ago, I was a federal law enforcement officer, and we went through this type of training, and some of it I still remember now. And so the repetition and the training, if you do it enough time, it does become second nature, and it is a good program.
I need verbal de-escalation training.
I agree.
How much time do you have?
All right, so update of our agenda. We're going to move the mental health update to September. There's a number of items that fall under member comment. In order to get the room reset for a board meeting at 3 o'clock, we're going to move that mental health update. It actually coincides well. We have filed a plan with the state as it pertains to our mental health allocation. That plan has not been accepted, and so it probably works out well that we go ahead and push that to September, because I know there's some time-sensitive items under member comment, and we don't want to use up all of your time.
And the plan will be accepted. It's exceptional. I'm just, they haven't gotten to it yet.
Okay, I'm not sure. Thank you.
Thank you.
There's 1, 2, 3, 4, 5 items.
I don't have that.
Is that in the pieces of paper?
No, I don't have it.
It doesn't say on the agenda.
Who has that piece of paper?
This is member comments. Usually
Maybe Jane.
lists people's names.
I think it was on the original agenda.
No, I don't have it.
I have the original.
This is member comments.
No.
Well, it doesn't make
It's
any
okay,
difference
it
because
doesn't
it's
matter.
not that important anyway, Eric. But I just wanted to highlight a few things. These are quick, okay? Quick. The first thing that I wanted to talk about a minute was our agenda, and I wanted to say that we had discussed our legislative agenda back in June. And we wanted to add those things to it that Sonia mentioned today, and make sure that that was okay. We will be going before the legislative delegation in early September, and we want to finalize our agenda, so we want to add those things to it. So if it's okay with everyone, then we will move accordingly. Do you have any questions about the legislative?
No, well, before you add what Sonia wrote down, which I quickly jotted down, there was one that were you saying that we would just add it on right away, or we would talk about it? Because
we don't have time to talk about it. This is our last meeting to discuss it.
There was
but you have a copy of the priorities.
Mm-hmm. I thought you were talking about just automatically adding on what some of the items Sonia mentioned, which there's one in particular I wanted more information and had concern, so I would not be supporting that if it was just added on there. That's my point. Is the IEP parent permission required? I would not support that. I recognize it's a barrier, but that's not something I would support.
Obviously. Okay, so that's not one that I'm really concerned and worried about either. I think that will be a stretch to get that approved. I know that she thinks it is important, but I think that would be a stretch to get that approved. But this will be primarily with the addition of a couple of the things that Sonia mentioned. I think this will be primarily what our priority list is. Eric?
I've said this before, and when I go to legislators, it's really, really difficult for me to highlight all these items because they don't want to hear this many items. And if we're going to add to it, I mean, I'm just saying from one personal person, it's a lot easier for me to highlight particular issues.
Do what you will, discuss what you will. You don't have to discuss everything that's on our priority list.
Well, I don't want people to say, well, the board agreed and you got to agree with that.
Do what you will. Okay. I think we're giving up and all agreeing on anything. Okay. It's good to have discussion if at the end of the day we can move forward.
Again, I just want to say, I'm not saying that any of them aren't good issues. The issue is you have the limited attention span in front of that legislature, and so for me, I hammer on about Summer Learning Academy. That's great. So
go right ahead.
Are we voting on this?
No, we're not voting on this.
Oh, so we are.
Yeah. No, we're not voting on this. But, I mean, we've already talked about this and I think agreed to this back in June. Shirley is not here. And as I say, we're going to add or expand on it a little bit. And but we won't have another meeting before we actually go before the legislative delegation in early September. So this is, Todd and I will do that. So the next point is the superintendent's evaluation. It's time to do the superintendent's evaluation. We have already discussed this before, and we will spend our meeting the middle of September discussing that that process and how we arrived at our evaluations. So between now and the middle or the 20th of September, you need to schedule an independent one-on-one with the superintendent to go over the evaluation tool that we currently are using, which will be changed after this current evaluation is completed. This is the process we are using. We are going to fill out our evaluation, discuss it in depth with the superintendent in our one-on-one meeting. After that, finish anything off that needs to be and complete and compile it and figure it out and make it a document that you can bring to the board meeting on the 20th. There will be no sitting down and adding up scores or changing numbers on the 20th. You will have your final document. You will read from the document at the dais your interpretation of the superintendent, not anyone else's. There will be no adding up all 5 and dividing by 5 or any of that. And you will give him an evaluation and some written some comments and remarks based on your evaluation. At the end of the time that you speak, you'll sign it. It'll be passed over to Kathy Tompkins and will become public record. Eric?
We all agreed when we initially created this rubric that it would be an average.
No, we did
Yes,
not.
we.
Yes,
It's
yes,
on-
actually we
it's on
did.
record.
It's on record. It's on tape.
That's why it's wild to me that you're just sitting here telling us how we're going to do it when we all adopted and created it. And this particular topic was discussed in depth, and it's on audio tape. I will find it. I'm happy to share it.
Yeah, it's on audio tape. We all agreed to a process. Why would you change the process
okay,
at
but
the end?
it will be completed before you step into that room.
I'm fine with that.
Because that was not the case last year.
That's what
if
I
you
wanted
remember.
it to be last time, and wanted it to be submitted to Kathy Tompkins beforehand. So
Mine
I'm
was
fine with that.
completed ahead of time. And
No, I watched the two of you making your notes there. It was really bad.
Are you serious?
No, don't.
Yes, I am.
You can't remember. You've got to be.
Don't start with that stuff.
What did I change? What did I change?
You didn't change anything.
I know I did not change anything.
Because I had my wrong PDF stood up that didn't have the weighted, which is the only thing.
Yeah, well, what did I change? I can do my numbers very easily.
I didn't know that it was that way. I don't remember it that way. We'll figure that out. But at any rate, come prepared to give a verbal of what your written and completed is, sign it, give it to Kathy Tompkins so it can become part of the public record. And that's the way we're doing it. So that's what I wanted to mention. Now, as far as putting together a new evaluation tool for next year, do we want to do that at our October workshop?
Yes.
Yeah, sure.
Because then you will have gone through this process again, so we'll have some ideas of what we want to do at the October workshop.
We'll also have the numbers that we need if we want to put something in there regarding this district has accrued by 5 points more or something like that.
Well, those would be synopsis kind of this
Yes.
year. Is that what you mean?
Yes.
The superintendent has mentioned that by the end of next week, he'll have some of that documentation out to all of us.
So that when we evaluate them, we can evaluate them on exactly what has increased or decreased or.
Are we going to be having enough time? Because I remember last time it took quite some time to come up with a evaluation tool. Should we have a separate meeting to do that?
Aren't we using the same one?
No, I meant for the October.
We're going to get a new evaluation tool to use in place of the one that we're using correctly.
Correct. And I
Right
just remember.
now, we're using the one that we used last year.
Correct. I'm just
We're not changing in the middle of the string, but next year we'll change.
My question was.
Do we need any additional time?
Additional time, because it took a long time to come up with something for us to all agree to. And I think that doing it here, rush, is going to be very problematic.
I think what we can do is
You're the chair. I'm just giving
make that determination as to if we need an additional workshop, we'll do additional. But I haven't made that determination as of yet. So it will either be in October at that meeting, or there will be a special meeting to do that. Audit committee choices. We have all of you scheduled a meeting with RSM for, have you gotten?
No.
They haven't contacted me.
You were emailed from RSM about having a meeting with them one-on-ones next week. Is it next week?
Yes.
So please refer back to that, or Kathy, would you send that out again today, please? If there are changes to any of the minutes of the meeting, and it's sent out from Kathy a couple of days after we finished a board meeting, you can make changes to it and send it back to her, and we don't need to move that item to new business. So I would encourage you all to do that, and to do it quickly, and to say, yes, I approve, or no, I don't approve. Some people are doing that, others are not. And go forward with that. And then I guess the last thing is the hearing of citizens. Do we want to go with two hearing of citizens, as the city of Sarasota does, and Hillsborough County Schools and Pasco County Schools are now doing? Do we need to do that? Are we?
I know we talked about this when I first got on the board, and I actually think that it does abide for a better meeting if we started with the first section is for hearing of citizens for agenda items on the agenda. Just like when we add an item that's not on the agenda, we have to open it up to public comment. So I'm fine with that. But here where I get worried, because I think it's important if we're about to take action on it. You want to be able to hear from the citizens, and in the event there's some outlying issue that's going on that funnels in there, and it could be a very long time. My only concern is putting too much time restrictions on it. In general, but I think setting it up that way, I'm fine with that. I know the county does it that way, so as long as people have an opportunity to speak.
What do you mean by putting too much restrictions? I'm sorry, I don't.
Time frames. Like, for example, Hillsborough County, we talked about it years ago, they have a very specific, it's a block of 45 minutes specified, and I think county's actually pretty similar, 45 minutes specified to the specific agenda, and then we would take action on the agenda, and then they open up to public comment. Now, sometimes there could be something we would have on the agenda that would obviously rise for an increase beyond 45 minutes. I just want to make sure we don't hijack the public's opportunity to speak.
I don't think we were thinking about, were you thinking about limiting the time?
No, I wasn't. I'm saying I don't want that.
No, okay.
There's been, we did have a student who was very upset with our board hearing of citizens, and that's why we moved them from this side of the dais to the other side. Hold on, Eric, please. And I'm very aware of some of the things that are said and how they might be interpreted. And we thought that it was just too close of proximity for students, so that I think it's better if the student sits over on the other side. But basically, I just thought maybe we ought to make that decision when Shirley comes back next month as to whether we go to that second situation, that second hearing. And what Hernando and Hillsborough are doing, I understand, is they are not recording those comments at the end of the board meeting. When the board meeting minutes and the total agenda is completed, before those people speak, they stop recording. Okay. They don't have those people.
But that's okay, because really the people are coming to speak to us.
Yeah.
Some ask for, like, hey, may I have a document, and they want to put it into the formal record, but I mean, we don't.
Well, I don't know. I'm just saying we can do it, but let's think about it.
Yeah.
And maybe discuss it again in September. I don't think we're ready to do it or to do anything now. And that's kind of what I had.
I had my hand raised.
Oh, I'm sorry, because I hadn't finished yet. You know, it's one thing to raise your hand. It's just like a student. But I was still.
But then you let her speak, and then her speak.
I interrupted.
You let everybody else speak.
It's because I didn't want you to speak, because I want you to play the victim, right?
No, I'm not playing victim.
Eric, could you speak, please?
Yes. I think that. I think you're gonna open a can of worms, because what are you gonna do when somebody comes in the beginning and they don't speak to something on the agenda item? I mean, it just causes. We're just going to cause unnecessary grief. I mean, as somebody who's had to sit here where people have just filed in and have attacked me and called me names and whatever, you just sit there and you just take it. I mean, they have that right. I mean, to try to bifurcate the two. I just think we're gonna end up with more problems than it's worth.
Well,
that's my personal
We haven't
opinion.
decided yet. I just thought we would mention it. I mentioned it on the phone the other night, so I thought I would mention it live today.
I mean, because the question comes in is, what are you going to do when somebody comes in and speaks something against the agenda? And I just think we're opening up, because people are going to come in. If we do this, people are going to come in and test the issue.
Oh, I was just going to say you'd recommend. I don't know if I was thinking you'd stop. Be like, the first part of hearing of citizens is for the agenda, and the last part is for final comments. I don't know. But, yep. So to be continued.
Yes, to be continued.
But they can only speak once.
Yeah.
Oh, yeah.
Well, I mean, they can speak 3 times if they wanted to on different subjects right now. They could fill out a card 3 separate times.
Really?
And we have had people who have done that. Oh, yes.
I didn't know that.
Hold on. So somebody can come up and...
Beware, now you're going to get like...
I understand that they can...
Lay low on this one.
Okay.
You're going to get somebody with...
Wait. I understand if we add an agenda item and Art says you got to have it open to the public, I understand that. I can't believe that people can come up with multiple items and have multiple cards. I've never seen that.
Usually on one item on the agenda, and yes, it does happen at board meetings, and I have seen it on other school board meetings, but
maybe that's because they require you to speak only a particular agenda item. If you have it open, you get 3 minutes to speak.
That's it.
You get 3 minutes to speak.
I would rather stay longer and move the business of the board forward. So if we have 60 people or 30 people out here, which we might, I would rather have that at the end after the board is finished with its business.
Well,
that's why I like the 2.
Well, but yeah, I think, but that's where you end up having a timeline. Oftentimes, I've seen in other governing bodies that do it that way. Because if you just leave it totally to the end, part of me thinks, well, a lot of the purpose of public comment is to share their support or feedback or opposition to what we'd be voting on.
That would be the first speaker. That would be where it is now.
Yes. And I would be okay with that, with the agenda.
And the other one will be at the end.
And if they came up and didn't speak to the agenda, he's saying, what are we going to do, gavel them down?
You all would criticize me on Facebook about it.
No, you can set up something where you can close their agenda or close their mic off.
Well, see, I don't want to get down that.
I'm not going to do that anymore, because I've already been criticized of freedom of speech, and I didn't cut anybody off. I cautioned someone, but I didn't cut them off. And at the same time that we were having our meeting with some disgruntled citizens, Manatee County was sending people out.
Yeah, but they were I mean, there was a difference in my personal opinion, but whatever.
And you also run the risk when you have people at the end. One of them that they're asking you to do something they want you to act upon. And then the meeting's over, and we don't have the ability to act upon what it is they're asking you.
I don't think I'd be in favor of acting upon something because a citizen came and wanted us to act on it without having any discussion. So if they're talking at the end of the meeting and they ask for something, then it would have to go to the superintendent and we'd have to discuss it.
You never know.
Typically, but again, if I use another governing body, like I just use the county, they do have a subset for public comment to specific to the agenda. Then the action items are taken, and then you can open them up. I think to Eric's point is saying that in the event, I mean, it's just, is it really final strict lines? No, but that's what we're trying to do that's also helpful for people who come to speak specific to the items that we're going to be voting on. And then, but there just has to be discretion where we're not gaveling people necessarily. It's a guide, for example.
But the county is different because they have an all-day meeting. So they have it in the morning, then they have it when they come back from lunch.
Yeah.
We sit here at all at one time. We don't break for lunch during our meetings. I mean, it's a different setup.
Well, you can just think about it, or maybe talk to other people about it. I just brought it up. And
For the record, I'm in favor of doing that. I see benefits for us as a board to be able to have two meetings.
Two public comments, one specified to the agenda and one general comments.
And the last question that I have is, of course, there was an article in the paper today about the investigation of Jeff Maltzby and additional things, and that do we need to have the board approve of expanding that investigation?
I have made my request in writing to the investigator. I've copied each of you on it. I've not heard back in regards to that request. Lynn Peterson, who was in front of us multiple times, is the point person for that. Certainly you could reach out to her between meetings and see if any action is required at tonight's board meeting. Art may be a resource on that also.
Yeah, I would like to ask Art about that because I'm not really sure.
Yeah, because I'd like to not go close shop and then you not have an answer. I'd rather have an answer for you for today.
Exactly. That's my point. Okay. Anything else? Then we are adjourned until our board meeting at 3 p.m.